Madam Chair, we're live.
Good morning. Doesn't it feel funny to be here in person? There's hardly anybody here. It's like we forgot how to do it live. Welcome to Joint Labor Committee for the Wyoming Legislature. And we have a few paper pushing bits to do before we start. Just for those up here among the committee, we've got these really fancy microphone thing, which you will have to turn on to speak. LSO has pointed out, make sure it's, I know you already want to turn it off when you're not speaking anyway, but evidently the speaker part, the hearing part doesn't work if your light is on. So then you won't be able to hear as well. So you really, two reasons why you want to turn it off when you're not talking. Do we? Okay. Welcome, Co-Chairman Baldwin. Do we need to call the roll before we discuss business? I guess, why don't we have that be the first thing?
Good morning. Senator Bouchard.
Here.
Senator Furphy.
Here.
Senator Hutchings.
Here.
Senator McEwen. Representative Clifford.
Here. Excused. Oh, is she? Here. Oh, welcome from Washington. Oh, there you are. Sorry.
Representative Connolly. Representative Flitner.
Here.
Representative Hallinan.
Here.
Representative Ottman.
Here.
Representative Romero Martinez.
Excused.
Representative Stivar.
Present.
Representative Worf.
Here.
Co-Chairman Baldwin
Here.
and Co-Chairman Wilson.
Here.
Madam Chair, we have a quorum.
Very good. Thank you. Okay. As far as rules of operation, Co-Chairman Baldwin and I figure we can just work with the same rules we had last year, which is co-chairman and that sort of thing. So unless there's discussion on that, I was planning to chair today other than when I present the bill, and Co-Chairman Baldwin will present tomorrow.
Perfect.
And Mr. Brody, is there anything else before we start the agenda that we need to dispense with?
No, Madam Chair.
Okay,
Madam Chairman, do we need to discuss the voting procedure?
well, Co-Chairman Baldwin, Mr. Brody told me that if we wanted to just acquire what we did last year, which was that same thing, then we didn't need to delve into it further. So
Perfect.
very good. So the first item on our agenda, oh, look, we're 4 minutes ahead.
Excuse me, Madam Chair.
Senator Hutchings.
In regards to the voting, I'm new to this committee. This is the first time I've been actually in person in a joint committee. Could you explain what those voting rules are?
Sure.
Thank you.
What we have typically done here is just if we vote to sponsor or not sponsor a bill, we've gone with majority vote of the whole committee rather than by chamber. And we found that works better just because people are absent in the summer, and so that's what we're just gonna do. Okay. All right. So the first topic for our consideration is Wyoming workforce. We have Director Cooley, and hello, welcome. It's nice to see you. I'm just going to be happy all day, I think, that I'm seeing people in person. So you probably have a number of things. We've asked you to present on workers' compensation. And I know a couple of the other issues were things that you brought up, and committee, it may take a little bit of, oiling the gears just to remember how to work our interim. And Representative Clifford online, I apologize, the screen is not in my immediate, I may have to really turn my head. So if you have a question and feel the need to really flail your arms, and if I don't see you, someone will point you out. No, and I hope your family member is okay. Okay, go ahead, Director.
Very good. I think I've got my mic on correctly. So welcome, Co-Chair Wilson, Co-Chair Baldwin, members of the committee. My name is Robin Cooley, and I'm the Director of Wyoming Workforce Services. We are pleased to be here for the first time in a committee meeting in person for quite a while. So it feels very good, I have to say. We have a number of individuals here to speak with you today because the topics that you've requested us to speak on really span quite a number of units within our office, 4 units actually. So we've got 4 people here to speak with you about workforce and workforce topics that you've asked for across our agency. And I'm pleased to introduce you to the individuals we have here today presenting that information. First, to my right, I've got Jason Wolf. He's the administrator of our Workforce Standards unit, which includes workers' compensation. So he will be talking to you about the program summary, gap in coverage, workers covered by self-insured employers, and workers' compensation youth labor. I also have Christina West here. She's the Deputy Administrator of our Employment and Training Division. She will talk about work experiences, opportunities in our 20 workforce centers across the state of Wyoming. I also have Nikki Harper, who is our Vocational Rehabilitation Administrator with the Division of Vocation Rehabilitation in our office. She will also talk about work experience opportunities with our Voc Rehab clients across the state. And I've also got Shay Moon here, who is our new Business Training and Support Unit Program Manager. She will speak to our work experiences available through our Workforce Development Training Grant Fund program. So that's going to include our apprenticeships, our internships, our training opportunities, our training grant funds for existing workers to train them on the job, but also to pull individuals in internships and apprenticeships that give them that work learning on the job. So with that, I'm going to turn it over to Administrator Jason Wolf.
Thank you, Director. Members of the committee, thank you for having us. I'm Jason Wolf. I'm the Administrator for Workforce Standards, as Director Cooley indicated. Part of what I oversee is workers' compensation. And so today, I think in your materials, you do have a presentation titled Wyoming Workers' Compensation that we have put together for today's meeting. I think some of you who have been on this committee have probably seen a similar presentation to this. I've kind of adapted this presentation to today's specific topics that you'd like to talk about, which I think are the gaps in coverage that might exist as it relates to some of the employees and stuff that are not covered under workers' compensation. Kind of became a topic during the COVID stuff. So I'm happy to do whatever the committee's pleasure is. Really, I think the crux of what the committee would like to know starts on page or slide 16. And that is titled, What is an Employer? I can start there. I can certainly start from the beginning, but in the interest of time and hopefully not putting you all to sleep on the first day of the meeting, I could start on slide 16 if that's your pleasure. Yep. I did bring some public copies too, if you need them. Page number. My apologies. So is the if Madam Chairman, if it's okay with you, I will start on that slide 16, which is what is an employer? Or if you would prefer, I can just kind of breeze through the beginning as well. So. Okay. Madam Chairman, members of the committee, so I know there's a lot of new members on the committee, and just a brief overview of what workers' compensation is, of course, is a program. It's funded by employer paid premiums. And when somebody's injured on the job, they are then eligible for medical and indemnity benefits or lost wage benefits or impairment benefits. In exchange for those, the employers receive what protection against lawsuits from the injured individual, which we call the exclusive remedy. So that is the injured worker's exclusive remedy is to file for workers' compensation when they're injured on the job. And then just to get started, and what is an employer, but so all employers in the state of Wyoming, when they're doing business here, they have to register with workers' compensation. From that registration form, we determine if they are what we call required coverage or if they are optional coverage. So Wyoming statute 2714-108 actually goes through the what we call NAICS codes. That stands for North American Industrial Classification System. And so it spells out which employers are required under the statute and which are optional. So all of the required NAICS codes must have workers' compensation through the Wyoming Workers' Compensation Fund. Okay, so now kind of, I guess starting on, and I apologize, no page numbers, but slide 17, which just defines an employer in statute under 2714-102, is basically any person who has an employee that is engaged in extra hazardous occupation or who elects coverage under the statute and has an employee working in Wyoming or in the United States, Mexico, or Canada. Those injuries will be covered. On to slide 18. Who is required to carry workers' compensation coverage in Wyoming? So the required, any employee performing work in a hazardous sector or subsector defined under the statute 2714-108. And then the statute spells out who is optional. So the statute 2714-108 really is the easiest way to explain it is that any NAICS code that is not enumerated in that statute is considered an optional coverage employer. So only the NAICS codes that are spelled out are the ones that are actually required coverage. So an example on slide 19, agriculture, sector 11, both crop production and forestry and logging fall under sector 11, but there's certain subsectors under that. A required subsector would be forestry and logging, and an optional coverage employer would be a crop production or animal production or crop production, excuse me. On slide 20, retail examples. I think this is where the biggest topic of conversation, at least in my office, has come up. Received a lot of phone calls during the pandemic about who's covered, who's not, as it relates to retail stores, et cetera. So on this slide, you'll see the required ones, required NAICS codes would be things like gas stations, auto parts stores, warehouses that handle, boxes, containers, use forklifts, pallets, those types of things. Optional would be your typical grocery stores or super center. Super centers can be kind of an odd classification in that when we think of it, we think of the big box super centers. That's not always the case. Things like your Dollar General store, smaller retail outlets fall into that NAICS code as well.
So, Mr. Wolf, just to clarify then, so that we make sure that we're following. So on the previous page and this one under optional, so if you had a ranch hand who was tossed by a cow, say, or something, or a grocery store worker who slipped on a banana peel, those people might not be covered by workers' comp. And then if they had to go to the doctor or whatever, that would just be up to, how is that resolved then?
Madam Chairman, so I think it's important to note, and I kind of get into this a little later in the slideshow, but it's important to note that even an optional employer who's not required to have coverage under Wyoming statute with us does not necessarily mean they don't have coverage through another party. And so a good example is a lot of the retail outlets, in particular your big box stores, that are nationwide, they have the financial resources to sometimes fund themselves, meaning they have an internal type of a workers' compensation program, or they have what we call a TPA, a third-party administrator, that is like a nationwide insurance company that covers these people from California to New York if they get injured in those stores.
But if it weren't a large, let's suppose it were a single family ranch with a ranch hand. If if the ranch hand is injured, then is that just up to individual negotiation between the employer and the employee? If the employer says, fine, you go into the dock in a box and I'll pay for, but that's just up to whatever they decide between them. Is that right?
Madam Chairman, that's correct. So it kind of goes back to that, what I was talking about, their exclusive remedy. So if an employer who is optional coverage elects not to have any type of coverage for their employee, they've opened themselves up to a lawsuit, basically. And so they'll resolve that either through, just negotiations, or it could end up in court.
Senator Furphy.
Thank you, Madam Chair. Let me ask about businesses that do multiple functions. So if part of their business is pretty high risk, but the other is maybe a retail that's not high risk, what do you do? Is the whole business required to be covered under that situation? Thank you.
Madam Chairman, Senator Furphy. So there is actually a section in statute 2714-108 that specifies where their primary generator of revenue is. And so if you have, for instance, a hotel is a really good example, where we have hotels that want to claim they're just an eatery because that's a cheaper NAICS code. And that's not the primary source of their income. The primary source of their income is a hotel, which is a little bit more higher rate. And so that's where the bulk of their revenue is generated. That's what we would classify them as, is a hotel, not an eatery.
Go ahead. Thank you.
Okay, on the next slide, school districts. This is another typical one that they're not specifically enumerated in statute 2714-108. But there is a section also within that statute that says that this act applies to governmental entities engaged in industrial classifications listed under subsection A. And so what that really boils down to is that while school districts are not obligated to cover all of their employees, they do cover things like their grounds crews, custodians, and certain teachers who would otherwise be classified as a hazardous occupation outside of that governmental entity. For instance, like your science teachers, wood shop teachers, home ec teachers. If they're working with that hazardous equipment, then those people are required to be covered under the statute. On the next page, I just have some employer statistics there, and this is kind of where we tried to really using our research and planning department out of Casper, coupled with the numbers that we were able to, extract out of our workers' comp claims system, really try to boil down how many employees are not covered in the state of Wyoming, I think is the ultimate question we're trying to answer here. But so this page, you'll see that important again to note, these statistics were pulled from April 1st, 2020 through March 31st of 2021. During that time frame, we had 16,613 registered employers in our system. Of those, 11,319 of them were required coverage. 3,021 of those were what we term as non-resident. Those are the people that might come in from bordering states to do work, but they might be hiring Wyoming employees. They may also bring employees from that state. Average annual premium per employer was about $12,212. And total premium collected in state fiscal year 2020 was $138,452,732. On the optional coverage side, we have a total of 5,294 employers covered. And those are, again, people that didn't have to have coverage with us, but elected to do so.
Representative Connolly. Oh, yes, you should share. Senator Furphy should share with you.
Thank you. Before we move on, I'm curious about how many total employers that we have in the state. So to get an idea of the relationship between those covered and not covered, and then the same in terms of employee statistics.
Mr. Wolf.
Thank you, Madam Chairman. Representative Connolly, I think, and I have another slide down the row here that might cover that. And I may not have put that in the slide. I apologize.
So thank you. I'd appreciate getting that at some point. And then I'm also curious on that slide on employer statistics where it's the average annual premium per employer. Do you ever break that down per employee? How does that work?
Madam Chairman, Representative Conley, we possibly could. I don't think that we have ever done that. We generally, when we talk about how much it costs, we talk in terms of payroll. So when we say, again, kind of using a hotel NAICS code as an example, we say that is, it might be $1.50 per $100 a payroll to cover an employee. So, and that's how we kind of base the workers' compensation rates is per $100 of payroll.
Chairman Baldwin.
Thank you, Madam Chairman. Just a question. I didn't see it covered in the future slides here, and that's just a quick question is where do things like search and rescue groups or volunteer fire departments, which are certainly hazardous occupations, where do they fall under the workman's comp?
Madam Chairman, Senator Baldwin, they fall, there's again, another section under 2714-108 that's specific to volunteers, like volunteer firefighters, search and rescue. Those are covered under most of the city NAICS codes or the county NAICS codes. And those are required coverage.
Go ahead.
Okay, so a total back on the employer statistics slide, total annual premium collected about $177 million. And then moving on to the employee statistics page, we have, so the total work comp covered employees for 2020, about 256,333 total employees covered. And then using, this is where we got these numbers, just kind of to back up a little bit, can be a little bit tricky to delineate and a little bit tricky to grab a hold of because they fluctuate all the time. And so to just keep in mind that when you're looking at these numbers, this is a snapshot in time. They vary widely over quarters. And so depending on how many employers we have come into the system, how many we have exit, et cetera, those numbers will go up and down daily. So, but then the total Wyoming employment numbers we peg at about 279,462. And what that really means is those are people who were eligible for employment in the state of Wyoming and were working. So.
Representative Connolly.
Thank you. And just a clarification. While this says employee statistics, do you really mean people or do you mean jobs? Because some are multiple job holders.
Yeah. Madam Chairman, excellent point, Representative Conley. And so the limitations to this data are that, for example, when you look at either of those numbers, I'll use the 256,333 as an example. The limitation to this data is you could have a person who works full-time at this job, but does waitressing part-time. And so that one person's actually counted twice. So.
Madam Chair.
Representative Hallinan.
Thank you, Madam Chair. You said that the counties are required to have coverage for the firefighters. And I wonder about the volunteer firefighters that don't get any salary. So how would they apportion those fees for workman compensation on them?
Madam Chairman, excellent question again. So with any volunteer, the statute again says that they must cover them if it's a hazardous occupation like search and rescue, volunteer firefighter. So when we figure the annual rates for the workers' compensation system, we do what we impute a wage. So basically we we make up a wage for which that entity pays premium on. It's very minimal. I think this last year is about $256 a month that they pay premium on to cover that employee. Does that answer your question?
Go ahead, thank you.
Okay, I think still on the employee statistics page, any other questions on that that I can answer? Again, just broke it out by required coverage, optional coverage for that.
And Mr. Wolf, just for 1 second. So Representative Clifford, I just want to let you know that while the screen is being shared, I really can't see you if you're up there. So in case you have any questions, you might need to maybe send a text to Katie Talbot or something like that, and we'll try to address that. Sorry, go ahead.
So on the next slide, top optional NAICS codes that elect coverage and their annual payroll.
I didn't mean you had to take it off. Sorry, go ahead, Mr. Wolf.
So these are just some of the top NAICS codes that we pulled out of our system and their payroll. These are the optional NAICS codes. So the first one there is NAICS code 611, which is educational services. And this is going back to the earlier slide where I talked about some school districts elect to cover almost all of their individuals. Some only elect to cover custodians, grounds crews, and those that they have to. Banks and credit unions are another one that elect coverage through us quite frequently, and you can see their payrolls are pretty substantial there, and that would be a good indicator of how many people they have, how many people we have in the system that are being covered. Down that same slide is NAICS 423, merchant wholesalers. Durable goods, those are things like your hardware, lumber stores, things that we use. And administrative and support services, again, that is, oops. Sorry, my computer went haywire there. But those two NAICS codes, the 423 and the 424, those are both the retail NAICS codes that we talk about. And the 424 is your grocery stores and all those retail outlet type things that we might buy and consume. And you can see their payroll, you know, especially with the grocery stores, has fallen down quite a, you know, not quite as substantial as the other ones. So. Okay. So I'm on slide 25. Okay, there we go. And this is the top optional NAICS codes that do not elect coverage. So these are the ones that are optional and have just elected to go their own way. Maybe they have their own coverage, maybe they don't, but the statute allows them to do that. So 624, these are establishments, and important to note here, I didn't put it in the slide and probably should have, but that NAICS 624 for providing services for the elderly and disabled, those should be noted. It's not medical services. So these are what we would probably term as like adult daycare type facilities that might monitor the elderly or disabled for a period of time for the family while they do something else. So. Also computer programming services, office administrative services, general management and consulting services, computer design systems. Those are all NAICS codes that are pretty substantial, I think, within the state, just have not elected to do coverage. So. And you'll notice down at the bottom, in all, we had about 3,150 businesses register with the workers' comp division in fiscal year 20, and roughly about 1,900 of those employers elected not to get coverage through us.
Mr. Wolf, let me just, I'm flipping back to the page. So I'm a little confused with that number. Okay, on page, whatever page it was, total covered employers, 16,613. But 3,150 businesses registered with the division. I thought you said all employers had to register. So I don't understand the difference between those two numbers.
Madam Chairman, so the difference is the 16,000 number, those people could have registered 4 or 5 years ago. The 3,150 number are businesses that registered just in that fiscal year.
Got it.
Okay. Moving on to slide 26, it's titled Self-Insured. And again, this is, I've received a lot of phone calls during, the last year about this in relation to kind of the grocery stores and other, retail outlets. So Wyoming, important to note, again, we don't have any statute on the books that allows us to regulate or enforce the self-insurance mechanism. So simply that statute 2714-108 just allows them to say that they can certainly opt into our coverage if they want to, not obligated to. And so we don't really know what those people do. They register with us, we tell them they're optional, and they go do their own thing. So we don't monitor that. We don't have any authority to do so.
Is that Senator Bouchard? Okay.
Thank you, Madam Chair. My question is there a way that they can opt into other insurance programs nationally? So I'm not clear on that. I've had a lot of questions from businesses that have the option, but they're not clear on how that's regulated to where they can go outside into another market.
Madam Chairman, Senator Bouchard, good question. Yes, they certainly have, once they register with us and we give them a letter that says you're not required to have coverage with us, they can opt into anything that's available to them nationwide. Frequently, what will happen is those big box retail stores, like I've mentioned, they usually have like 1 or 2 national firms that represent their workers' comp interests. So, a big box retail store in Kansas, Wyoming, California would probably all have the same person covering their people.
Follow up, Madam Chair. So what about a smaller store, not quite a chain, but a large store in Wyoming that possibly would be exempt? Do they have a way? Is there a way through, because I'm looking at maybe it's the insurance commission doesn't allow that company to work in Wyoming. So are there gray areas here where we can't let the private sector work the way it's supposed to under our current program?
Madam Chairman, Senator Bouchard, for optional covered employers, I don't believe there is any gray area to speak of. Again, they're free to elect coverage with anybody that will cover them. With a required NAICS code, however, under the current statute, you must have coverage through us. So an optional coverage employer, if they're, and I'll use an example of some school districts I know of have what they call a rider on their, like a Blue Cross Blue Shield policy, for example, that allows those teachers who aren't covered under our system to be covered under Blue Cross. But we, as the state of Wyoming, don't regulate what Blue Cross pays. So their benefits might be different than ours. They might not get certain benefits. Don't know, because we don't have the authority to either regulate that or enforce it.
Thank you, Madam Chair. So just one last question. What I'm hearing from the private sector is they come to Wyoming and it costs considerably more than what they pay in another state. So that's what I'm concerned with is have we looked at how do we handle that? Because we're trying to create an environment where we work for economic development to bring more businesses here. But yet this seems to be one of the hurdles that I hear about.
Madam Chairman, Senator Bouchard, I think, the cost is a good point. I think there's several different studies out there. I know Washington State puts out an annual study that ranks the states by cost of premiums based on workers' compensation. I think Wyoming is about 16th this year. And being number one is the best, the cheapest. And I think a lot of it has to do with our cost of healthcare in Wyoming. We have very rural nature of healthcare. There's, again, a lot of studies I've read that have, indicated our cost for, a back surgery versus Denver, Colorado is quite a bit more expensive. So, I don't know what the right answer is to that question, but I understand what you're saying. Okay, I guess moving on to slide 27, potential gaps in coverage. So I think the easiest thing, the potential gaps that we know exist are any NAICS code that is not enumerated under the current statute, under 2714-108. In 2020, some of the sectors with the most employees in the optional NAICS classifications, we have the merchant wholesalers, durable goods and non-durable goods, and the elderly and disabled. Those three NAICS codes alone account for about 10,754 employees in the state. And if we go, kind of looking at that number, you'll notice back on slide 23 where I have the employee statistics. The difference between those that we have covered in our system currently versus the people eligible for employment in Wyoming, we peg at about 23,000 employees in Wyoming currently that don't have coverage with us that could. And so that's roughly going back to that potential gaps in coverage slide 27. Half of those 20,000 employees-ish is in those three sectors. So your durable goods, non-durable good retailers, and the elderly and disabled. So 10,754 employees, if that makes sense. So I think basically what I'm saying is those, half of those 20,000 uninsured people, I shouldn't say uninsured, they're not insured with us, lie in those three NAICS codes. So, Madam Chairman, any questions on that?
I think I'll have some at the end, but we'll let you, okay, I don't see anything right at the moment. Go on ahead.
And again,
Let's come
just
back.
going on slide 28, Madam Chairman, the required reporting, just to make all the members aware, because I know there's a lot of new members on the committee. These are two reports that we are statutorily obligated to provide to this committee, and one of them is the actuarial report due each year on November 1st. And so that is a report put together by our actuary that basically says, here's what the fund looks like in workers' compensation. Here's our liabilities, here's our earnings, all those types of things. And then we also have the annual base rate report, which comes out October 1st of each year. Lastly, on slide 29, I just wanted to provide, these are some good resources and comparators. So there are North Dakota, Washington, and Ohio operate very similar to the way Wyoming does. In North Dakota, however, with very, very limited exceptions, mostly in agriculture, everybody in the state is required to have that coverage through North Dakota, which is, again, a state fund. Ohio, again, quite large fund, but they do, unlike us, they monitor those self-insured people. So if a Blue Cross, for example, is paying, then they monitor that those people are paying what the Ohio State Fund would pay. So those are just some good reference points if you're looking for comparators.
Senator Furphy.
Thank you, Madam Chair. On the actuarial report, do you adjust the premiums every year based on that report? And how do we look at this point? Are we pretty actuarially sound? Thank you.
Madam Chairman, Senator Furphy, yeah, so each year we have actually it's going on right now. We start it in about March, and by mid-July, end of August, we usually have the actuaries preliminary report that tells us what the rates for the following year will look like. Right now, the workers' comp fund is about $2.34 billion. And if in theory, our liabilities pretty much match that 2.3 billion. However, because we're a government entity and we're allowed to what we call discount those liabilities. So if you look at the future cost of money, basically is what they take into account. So really our liabilities sit somewhere on a discounted basis around $1.5 billion. Which means that if we closed our doors today, quit collecting premium, we would have the money to pay those without collecting further premium, in theory.
Representative Connolly.
Thank you, Madam Chair. And I've got a bunch of questions based on having this, I think, as an interim topic. And one of them was related to the pandemic and our understanding that not all workers were covered by our statutory change that allowed a presumption regarding COVID-19. So my first question is about what kind of impact did you see on workers' comp with COVID-19?
Madam Chairman, a good question, Representative Conley. With the presumption, I think the current numbers as of last week, we've had about 1,500 claims filed that fell under the COVID presumption. We've paid a little bit over $4 million out in indemnity and medical benefits. We unfortunately have paid on 5 death benefits as well. So not as substantial as I expected, to be honest with you, but each day it climbs.
Follow-up,
Okay.
Representative Connolly.
Okay. Now, this is a harder one, because, and that is, and again, there was concern that a significant group of employees would not be covered because of self-insurance. Do you have any ideas about those kinds of claims or any kind of proportion in relation to the 1,500 claims that you've paid out that for individuals who weren't covered? Because again, part of this purpose of this interim topic was for us to think about those who weren't being covered, especially with something like COVID-19.
Mr. Wolf.
Madam Chairman, Representative Conley, I unfortunately, I don't think we have any of those statistics for the simple reason that, when an employer registers with us and we tell them they're optional, we, for lack of a better term, wash our hands of it. We don't have any authority to enforce it or follow up on what kind of coverage they're providing.
One more.
Representative.
Okay. I like that you have some state examples next to us. Do you have any idea about how those states responded to COVID-19 in relation to payouts, presumption, things like that?
Madam Chairman, yes, we actually, our actuary actually gave us a report on that. I think I forwarded it on to somebody at LSO. I'm not 100% sure. Most every state in the union passed some kind of COVID presumption. Some were different than others, but in general, most every state in the union passed some kind of COVID presumption.
And Madam Chairman, and just any kind of follow-up in terms of numbers? How were their numbers in relation to our numbers?
So
Madam-
if I can, so Representative Connolly, I'm wondering, are you wondering, and maybe my mind might be going somewhere else, but given that we only know whatever percentage of 90% of the employees, I mean, are you trying to sort of have them say, well, in states where everybody is covered, the people that wouldn't have been covered in Wyoming were paid out at such and such a rate, and therefore we might make a hypothesis? I mean, is that where you're going?
Yes. Yeah, thank you,
Mr.
Madam Chair. That's exactly where I'm going. Just trying to get a handle on those who weren't covered. and what, or if we should do something about it statutorily, like these other states have done, which make it more complicated to get self-insurance, so to assure that individuals are covered. So I'm just curious about the numbers that you know from elsewhere.
Mr. Wolf.
Madam Chairman, I don't unfortunately have any of those numbers. We can certainly look and see what we could dig up on, what other states have seen in relation to, counts on COVID, payouts, those types of things, if that's what you're looking for. Somebody, probably our actuary, could work with some of the other states they work with and get some of that information possibly.
Chair,
Representative
I'd
Conley.
appreciate that. Can I switch gears and one other question?
Look, I was just going to
Okay.
say, although I would suppose, not that it's not good information going forward, but I don't imagine that we could retroactively charge self-covered employers to cover. I mean, it's like
Yeah.
that horse is kind of out of the barn, I think, but not that it wouldn't be good to know in the future. But okay, go ahead, Representative Connolly.
Thank you, Madam Chair. And I want to follow up on Senator Bouchard's kind of line of thinking in terms of costs. And one of your responses is that our workers' comp charges are 16th in the nation, so a little bit better than average. So I am curious about charges for self-insurance. So self-insurance seems to be more expensive. Would it honestly be better for companies in the state that we had obligatory state workers' comp obligations rather than just the self-insurance, other than, let's say, for Washington, there is a process for certification. So any thoughts about that?
Mr. Wolf.
Madam Chairman, Representative Conley, I think it's a difficult question, but I mean, the thought, again, in theory, if you add more people to an insurance pool, you could, in theory, reduce the costs because it's spread across some more people. That depends. There's a lot of variables there, though, on how, what's their safety culture of all these employers coming in? Do they have high rates of injury? Those are the types of things it could make things more costly. But again, does that answer your question?
Senator Bouchard.
Thank you, Madam Chair. We talked about actuaries. I would like to see what the employee liability is. Could this committee get a breakdown of how many employees it takes to run this department and what the payroll is on employees? Because I think if we were looking at a private sector company, and that is what the scrutiny is these days, is, well, the CEO makes this much money and these people make this much money. And, darn these insurance companies, look at how much they get. And I think that we have to hold the governmental, this is the same standard. And not that I'm saying that you guys are doing this, but I certainly would like to see that, to see how those actuaries play out as a comparison to a insurance company. So is there a way we could get that information?
Senator, are you asking as far as the overhead costs of this particular state agency as compared to the money that they're saving for the payouts? Is that what you mean?
Yeah, Madam Chair, I would like to see by employee, how much payroll per employee. The breakdown of everything, how much it costs to
run the
buildings,
program.
everything that's going. We look at how many buildings are involved here. On the map, it's all kind of connected here. I'd like to see where that breakdown is. I don't know, you may have an office in around the state that takes up office space inside of one of these buildings that has much more workload amongst the workforce, but I'd like to see what that all breaks down to, is, like you would in a private sector setting.
Madam Chairman, Senator Bouchard, the actuary report does have a table in there, and I can certainly forward that on to the committee, but it does list what our overhead costs are. I don't know that it breaks them down exactly like you're asking, but I can't remember off the top of my head, but overhead somewhere around 5%, including buildings, salaries, and all that stuff for the division.
Did you have a follow-up, Senator Bouchard?
Madam Chair, well then let's be specific here. Can we get, employees and breakdown on how much employees are being paid? I mean, I do get the percentages, but I would like to see really granular what's really going on. I mean, how many employees does it take, what their job titles are? And I'd like to maybe take that information myself and compare it over to the private sector.
It's probably in the budget bill, is it? I mean, are you, is it the workers' comp is probably a separate unit in workforce services, I assume?
Madam Chairman, that's correct. Yeah, so it's a unit 504, I think, in our DWS budget, lists the number of employees for workers' compensation. I mean, we can get any of the information you're asking for, I believe, just have to break it down.
Well, we'll let you circulate that over the summer, maybe. Okay. Okay, any more on this? Oh, Senator Hutchings.
Madam Chairman, thank you. This is a question based off of another question that was asked on the impact of COVID. And you said you had about 1,500 claims that were filed. Can you give me an idea, just for the sake of me wanting to know, what type of claims were there when it comes to COVID impacts?
Madam Chairman, Senator Hutchings, they've ranged quite wide and far, actually. So most of the claims, most of those 1,500 claims are what we call med-only claims, which means, you know, they got sick, they went to the doctor, they may be quarantined for a week or two, whatever the doctor told them to do. And, you know, we paid their medical bills. Again, some of them we saw quite critical. They were in the hospital for months. And again, had, I think, 4 fatalities thus far, so.
Now, follow up, Madam Chair. When you say they got sick and they were sent home, the workman's compensation, in my eyes, and maybe I'm wrong, it would be, I got sick based on something that happened on the job. How do you figure out whether this was a job-related compensation, or I just was talking to my neighbor and I got sick? How did you differentiate between the two?
Madam Chairman,
Wolf.
so with COVID, since the legislature passed the presumption was that if you came down with COVID, that it was obtained at work and covered as such. Under normal circumstances, that's obviously not the case. You know, they have a burden of proof to meet that either this injury happened at work or it didn't.
That was a bill from last year's special session that we passed.
Something I missed.
We only had
Thank you
3 bills.
so much. Yeah, 3 big bills. Thank you, sir.
Okay, any more questions for Mr. Wolf before he wraps up this a little bit?
Madam Chair,
Oh,
if I may.
Director Cooley.
I'm sorry, Madam Chair. Senator Hutchings, just to follow up on your point as well, one of the things that we're keeping our eye on and are very concerned about are the long hauler cases. We don't have any idea what that might look like for work comp payouts in the future. So that's a very large concern that we have, that we're keeping an eye on. If I may also, Madam Chair, respond to Senator Bouchard's question about work comp rates. Jason, correct me if I'm wrong here, but over the past number of years, we've kept our rates low with no increases at all. So I just wanted to point that out. I don't know how many years it's been since there's been an increase.
That's a good point, Director. Madam Chairman, I think just in general, the rates, I believe over the past 5 years have only increased at one point in time, and that was a 1% base rate increase. So
Go ahead, Mr. Wolf, any more on this? Or are we pretty much? at the
Madam
end?
Chairman, I think that's it for this.
Okay, actually, so then I have, one of the reasons that I put a little asterisk next to the self-insured. And committee, I do feel like to overhaul the entire workers' comp system is maybe a little bit of a heavy lift for us at this. I mean, I think we might not be ready to go there. But one of the concerns that I've had, and I have had, a few contacts from not even necessarily constituents, people on the kind of the gap area. And I'm wondering, Director Cooley, your thoughts on the potential for, I assume you would want statutory cover. I don't know if they're, but for your agency to provide sort of an ombudsman or mediating type role in the situations where you have employees who are covered by self-covered employers. I hadn't really thought of asking for those employers to have some sort of reporting to you, which sounds like some other states have some reporting requirements, even if you're self-insured. But as a former healthcare person, I really hate thinking about lawsuits. It's not what healthcare people like. But a case came to my knowledge where I really felt like the poor person needed a lawyer. And lawyers don't, legal aid, those sort of places do not take workers' comp cases. And I'm wondering whether, what I have seen, some years back, we had a lot more workers before your time, Director Cooley, but we heard more from Workforce Services. Mr. Wolf was there, I think, and you get the feeling that when the person is covered under the state plan, there's a little bit more assistance to the employee as far as legal, negotiation between the employer and the employee. And I'm wondering what your thoughts might be on whether that would be possible or advisable, how that would go about, what kind of statutory language, just your thoughts on that. I just feel for the person who really has no recourse when they're working for a large multi-attorneyed corporation.
Right. Madam Co-Chair, it's an interesting concept. I used to represent work comp individuals in court, so I know the situation that they face, and that's a very difficult situation, even when you've got the workers' comp division that's paying for your attorney in those positions. I guess I liken back to my days in the Public Service Commission, where we have the consumer advocate there that actually represents utility payers out there that really have no option to come in and no option to really present their case a lot of times, because those are complex cases. Is that an option that where a route this could go, some type of a consumer unit within the agency that assists those individuals in mediating those cases with those often very big insurance companies? It's an interesting concept. I hadn't thought about it, and we can maybe flesh it out, but I think there are instances in other agencies, like I indicated, PSC for one of them, that maybe could provide some kind of a model for that.
Any thoughts from the committee on that idea? Senator Baldwin.
Thank you, Madam Chairman. I think I would like to request the group to actually flush that out and actually get some examples and actually bring that back to us in our next meeting. And perhaps there is something out there legislatively that we can put forward to either create that position or explore that position. So I would like them to come back with some examples, cost, what it would do, how it would function, et cetera. I think that's a great idea.
Any other thoughts from the committee? So
Madam Chair.
Representative Hallinan.
Thank you, Madam Chair. I would think that we'd be interfering in this. These companies can be taken they can still have a lawsuit against them when they have this type of insurance, this type of workman's compensation insurance. So I think really that would cover that problem. I don't think that we need to interfere in that process. Thank you, Madam Chairman.
So Representative Hallinan, what I observed in situations is that legal aid will not take workers' comp claims, and it's very difficult for a person making, say, $15 an hour to hire a private attorney to take on an international company. I mean, I mean, I agree with you as far as, you know, you don't normally hear lawyer up out of my mouth. But I did have a did I see another hand? Representative Connolly.
Thank you, Madam Chair. And actually, my line of questioning was going along the lines, a different route, which was what would it mean to obligate all employers to have coverage so that we wouldn't run into that situation? Now, that's one route to go, and it looks like lots of states have gone at that route. Your route is somewhat different, but it does acknowledge those workers. And I'm thinking of someone who works at, for example, Safeway. Right? I think that's one of the examples. And then it concerned me that it would be the adult daycare providers as well that weren't covered. Again, like you said, that's $15 an hour, maybe folks are making. They came down with COVID. Their neighbor down the street was able to get workers' comp coverage. They have nothing unless they sue. That seems an incredible obligation on those workers. And so I do think that we need to do something about them. And again, that's why we had this interim topic, was our recognition that we weren't covering those folks when we passed that presumption in special session. So I would support going down that route. And let's take a look at it for next time.
So Director, our next meeting is in September. And so, you know, we're not quite ready to draft a bill, but maybe actually, well, as long as we had a bill by the November meeting, that would be okay. Wouldn't that be, Mr. Brody? If you could put together you don't have to have it all drafted up, but what it might cost, and I would suppose the workers' comp division is funded by the insurance premiums. So this would have to really be a general fund thing, because you can hardly get a premium from people who aren't paying for the insurance. But, you know, some sense of, and I realize you're kind of pulling things out of thin air, but hypothetically, what might be involved in a consumer advocate type function? And I mean, knowing this committee, I don't really think, Representative Connolly, that there will be wild hand waving to mandate coverage for everybody, but feel free to throw in a separate paragraph on what that would be like, just for thoroughness. And that would be really super. Do you have any questions about that before we go on to the next item, Director? Oh, Senator Hutchings.
Thank you, Madam Chair. Just to kind of understand everything that's being talked about here. You have people that are self-insured and you have people that are insured via the workforce services. They're optional and they're not optional. Those that are self-insured can come into the pool of workforce services if they like. So when you have a situation like COVID, and we're saying with the bill that the presumption is you got COVID based on being at work, so you're covered. And then we have the person who, based on their own choice and decision, decided not to be in workforce services and glean from the benefits there. Now we want to somehow include them in on this package of presumption. Is that what I'm hearing?
Senator Hutchings, I don't think exactly, because
Okay.
the Representative Connolly's inquiry was going forward mandating that all employers participate. However, we can't retroactively mandate people to now cough up for last year's worth of insurance. I mean, you can't mandate retroactive insurance coverage that I ever heard of. So that would not occur in that particular case. Although I'm not a lawyer. Maybe LSO might have to retrieve me from practicing law without a license. Senator Hutchings.
The gentleman, do you have a different answer or is yours pretty much the same, you two?
Mr.
on
Wolf.
which I am.
Madam Chairman, Senator Hutchings, no, not. a
I'm sure
different
Mr. Wolf would never have a different answer than me.
answer.
No, I'm just kidding. I don't know if Mr. Wolf is a lawyer either.
No, ma'am.
Oh, he's not there. Okay. Well, we don't have any. Oh, actually, Representative Connolly actually is not licensed in law, but has a degree. Representative Hallinan.
Thank you, Madam Chairman. I wonder whether the attorneys, don't attorneys represent people against the workman compensation department on the awards that they get?
Madam Chairman?
So Representative Hallinan, just, there's two separate things here. If the employer is covered under state workman's comp, there are lawyers. If the employer is self-insured, workers' comp is not involved.
I know.
So are you?
Well,
is your-
I'm saying that I think the comment was made that lawyers are unwilling to sue in workman compensation cases. But I think they do sue the workman compensation department when they don't think that the employee gets fair treatment from the workman compensation. Isn't that correct?
Mr. Wolf?
Madam Chairman, yes, that is correct. So I think the delineation that Chairman is making is that if we have a person that we've paid benefits to, sure, we pay for their attorney to sue us. And if they are covered by a different entity other than Wyoming Workers' Comp, that attorney may not be as willing to take the case on simply because they're not getting paid by us. They have to charge their client, if that makes sense.
Well, I would
Representative
say, yeah, don't attorneys take cases on contingency? In cases, wouldn't an attorney be willing to sue these big insurance companies or these big outfits like a big box company? Wouldn't they be willing to take a contingency case against them if they had a worthy case?
Madam
I
Chairman,
would think so.
I'm not an attorney and so my guess would be yes, they would, but I can't speak too intelligently to that.
So that's a hypothetical, and we can, if we have information from them at the September meeting, we can invite the attorneys of the state who want to take cases on contingency to show up and testify perhaps. Senator Bouchard.
Thank you, Madam Chair. I'd like to know how many cases there are. And also, isn't there some kind of immunity that kicks in that they can't sue you the same as a private sector insurance company?
Madam Chairman, Senator
Senator,
Bouchard. Exactly. So annually, we process between, I think last year, right around 12,000 claims annually. It varies again. Sometimes that's, I would say, roughly between 11,000 and 15,000 claims annually that we process. So at any given time in our system, there's probably around 20,000 active claims that we are paying on. Again, some of those are, we pay a bill once a year for somebody that is on permanent disability, and others are the ones that are active daily cases.
Follow up, Madam Chair.
Follow up.
I'm talking specifically about where someone says they want to sue you. So specifically, how many cases are there active right now? And then specifically, how does that immunity factor come into play?
Madam
Wolf.
Chairman, my apologies. I misunderstood, Senator. So we roughly, it's been a couple of years since I did the study, but it's less than 1% of the cases that we get annually that end up going to a legal proceeding. So I would say probably around 300 cases a year end up in some type of litigation. Now, the statute does not bar somebody from suing a third party. So if, for example, there was like a faulty piece of equipment, that injured worker can sue the manufacturer of that equipment. They just can't sue the employer.
But so Senator Bouchard, the point of our workers' comp, the state system, is that the employee doesn't actually have to sue because there's sort of an automatic enrollment in the compensation process. Is that right? I mean, I'm maybe not phrasing it right, but.
Madam Chairman, so yeah, they, again, kind of going back to that one of those first slides, if they are enrolled in Wyoming Workers' Comp, they have what is called the exclusive remedy, which means they cannot sue their employer if, no matter what happens on the job, they are covered by us. They can't sue the employer. Now, again, if there's a faulty piece of roofing equipment or something that failed, causing the injury, then they can sue the manufacturer of that company, in which case we go through the third-party subrogation and recoup some of the funds that we've paid out.
Madam Chair,
Director,
if I may speak, just one additional observation to Representative Hallinan's question. You make a very good point that there are attorneys out there that will come in the cases where there's no workers' compensation, and they will be willing to sue. But I would imagine that the cost benefit analysis those attorneys need to do, there's going to be very few of those individuals, of those cases that they will be willing to take. The majority of the cases we see are much smaller dollar amount cases, just to get basic payments for some medical costs. So the cost benefit analysis there is going to be very difficult for them to take those cases. So you make a very good point, though, relating to private counsel taking some of those cases.
okay, let's move on. The next item is your youth labor and the work-based learning, which I think were actually requests from you folks. So carry on.
Thank you, Madam Chairman. So on the next topic, just a brief update of where we are. I think most of you recall that we had a House Bill 239 that was passed this last session and provided for what we call workers' compensation student learner agreements. The bill, aims to take those students who are enrolled in some kind of career and technical education at a high school or community college, and allow them to perform certain hazardous occupations that might be incidental to their career and technical education training. So we are in the process of instituting emergency rules for that. The bill is effective July 1st, by the way. And basically just taking that bill, getting the rules ready and application process for those employers, employees, and training entities to have the application available for them. So really just kind of wanted, again, kind of a lot of discussion from employers to us and in our office about what students can and can't do on the job, particularly those students that are 16 to 18 years old. And that's really the heart of the student learner bill that was enacted here, to let those 16 and 17-year-olds who might not be able to operate a certain piece of equipment because of their age. But if there is an agreement, there's a provision under the Department of Labor's Wage and Hour Division that allows them to take part in certain occupations that would otherwise be forbidden for them to do because they're under 18. So.
Questions for Mr. Wolf? Okay.
Thank you.
Work-based learning. That's a separate topic, right?
Madam Chair, we're going to call up our three experts in that area.
Okay. Oh, and I see we have a separate handout for this. Do you have it? Welcome. If you'll introduce yourselves.
Welcome. Good morning, Madam Chair and committee members. My name is Christina West, and I'm the Deputy Administrator of Employment and Training. And I am actually going to start the presentation, but I'll move it on to Nikki.
Good morning, Madam Chair.
You might need to sit a little closer to the mic.
Madam Chair Wilson, Co-Chair Baldwin, members of the committee, I am Nikki Harper. I am the administrator for the Vocational Rehabilitation Program, and I will add a little more to Christina's presentation once she is done, but I will turn it over to Shaymoon.
Madam Chair, members of the committee, my name is Shay Moon, and I will follow these ladies on the presentation with our Workforce Development Training Fund and apprenticeship grants under our Business Training and Support Unit.
Okay, thank you.
Thank you again. Thank you, Madam Chair and committee members for having us here. We are super excited to be here just to tell you a little bit more about our work-based learning opportunities. We have these learning opportunities through many different divisions, and that's why you have us all here. So we'll try to keep this short and sweet. However, each division reports to different for example, I report to the Department of Labor, where Nikki reports to the Department of Education. So there are different rules for our programs. So we really want to get the word out and lean in to you to share that with the citizens across the state. So in my presentation, I'm going to be talking about on the job on the job trainings first, and then I'll talk about work experiences. And I'm really going to talk about the benefits to the participants. So those citizens of Wyoming, as well as the employers that we serve. You'll notice on the next slide, which is slide 3, that we have a total of 20 workforce centers across the state, located in various locations. We also have one satellite office, and that satellite office is in Powell. And all the services that we provide or that we talk about here today are provided in all these workforce centers across the state. So I'm actually going to start my presentation by talking about on-the-job training, or what we call OJTs. And any person that is eligible for WIOA, or the Workforce Innovation and Training opportunity, is eligible for an OJT, or on-the-job training. The on-the-job training can benefit the individual, the citizen, as well as the business. And so, real simple terms, we have a job that's been posted, and that person or that business is just having a hard time getting that position filled. And so they'll come to the Workforce Center and really have a conversation with our business reps about what's an OJT and how could I benefit from that. So on the next slide, it really kind of breaks down, and there's a lot of information. How does the employer benefit from that? And how does the participant? Well, the employer benefits because we, the Department of Workforce Services, this is the exciting part, we are paying 50% of that individual's wage. So while they're doing hands-on training and they're learning on the job, we're paying 50% of their wage. They can work up to 40 hours, and they can do that for a set period of time. And each job and each position, it's a different set period of time. So it could be something short, 400 hours, or it could be something as long as 1,500 hours. And the wages is really the going rate for that position. So you could see we could be paying quite a bit for that individual to get some hands-on training. Not only can they get hands-on training, but that individual could also possibly need maybe some credit classes at a community college. Maybe they need a degree or a certificate in order to have this position, a permanent position. And we can pay for that through WIOA. We also, through WIOA, could assist with maybe they need certain tools, maybe they need a uniform, clothing for that job. Those are all things that can be covered by the Workforce and Innovation and Opportunity Act.
So, Ms. West, let me just interrupt there. So just we've got a lot of new folks, so that WIOA is it's all a federal program, right? All federal dollars for that, just so that the committee knows.
Mr. Chairman or Mrs. Chairman and committee members, that is correct. WIOA is a federal program, and that is something that the workforce centers all are very aware of. The WIOA program, or Workforce Innovation and Opportunity Act, has eligibility requirements for adults, dislocated worker, and youth. And OJTs can be offered to all 3 of those populations.
Senator Hutchins.
Thank you, Madam Chair. And let's see, got your name, Christina. The Workforce Innovation and Opportunity Act, when did that come about?
Ms. West.
Madam Chairman and committee members, the WIOA program, or the act, was put in place in 2014 under Obama's administration. And so it's been something in operation for quite some time. Obviously, we've been learning and growing with it. And I'll kind of talk a little bit more about that when I move over to Nikki.
Follow up?
Thank you, Madam Chair. Christina, just a concern here. I'm kind of elderly, and when I was a young lady and I wanted a job, I went to a place, applied for a position, and the employer trained me. How did we get to the point where the federal government is now involved in training people to work for an employer and actually paying that person? What prompted that change in society? Do you know?
And Senator Hutchings, if I can let her have a short answer to that rather than a
That's fine. I can
lengthy.
get her offline. Thank you, Madam Chair.
Go ahead, Ms. West.
Madam Chairman and committee members. So the WIOA program, it is a federally funded program. And so we can assist in helping individuals obtain training. We don't actually provide the training. The training is done through a variety of training programs that have to be approved on what we call our eligible training provider list. So for the OJT, the employer can be the one actually providing the training directly to the individuals, or they could lean into a community college if that position required more of a degree or a certification that couldn't be done in-house, hands-on with the employer. Does that answer that question?
So I think the complete,
Madam Chair,
I
I
was gonna say the
will
complete
talk to
answer, Senator
Christine
Hutchins.
offline because I think there's more that I want than what you said. The whole thing is now the federal government is paying to have someone get OJT. Let's just say I'm going to bring up a big box store. Why doesn't the person just go to the big box store and they train them if they want to hire them or want to assist in helping a student out instead of that federal government doing the paying? My thought process is the box store should pay, not the federal government, but we'll get off the line.
yeah, right. Senator Hutchings, let's remember that we elect people to Congress and they vote for bills. Just like people in Wyoming vote us in and we vote for bills. Right? Ask your Congress people from 2014 who passed it. Okay, continue, Ms. West.
Thank you, Mrs. Chairman and committee members. I'm going to go ahead and move on to work experiences. That's the second work-based learning opportunity that we offer in the workforce centers. The work experience opportunity is really a temporary learning opportunity, and it is, again, very individualized. Department of Labor does allow this opportunity for adults, dislocated workers, and youth. However, it is really focused in on our youth population. The work experience opportunities are really about teaching someone employability skills. So maybe they've never worked before, they don't know those basics. It could also be teaching them an occupational skill, as well as just using the work experience to do some career exploration. So on the next slide, it goes into more details about the benefits to the actual individual, the citizen, as well as the employer. Again, I really think the participant or the citizen just really has that opportunity to work directly with a business and really just to have a growing opportunity to learn some of those very basic things that they may not know. While if you look at the wage details, the benefits or the perks, our department, the Department of Workforce Services, we pay 100% of those wages. So 100% of those wages to those youth, or even to those adults that may be transitioning, maybe they haven't worked for a long period of time, and now due to a life event, they're required to enter the workforce. We can have that individual work for up to 40 hours a week. So it can be a full-time opportunity or part-time, and we can pay up to 400 hours to that individual. So that's a big benefit to that participant, whether they're an adult or they're a young person. To the employer, it's a temporary worker at very minimal cost. That business is not paying any of the wages. So it is a temporary person for that business. There's also just that benefit of being able to work with a young person or with someone to train to teach them a new skill. So if we move to the next slide, it really talks about some additional expenditures that the Department of Labor looks at for work experiences. And I think it's just really important to note that Department of Labor has really high expectations on how we, Wyoming, spend the money we receive for youth. We are required to spend 20% of the money we receive on youth funding on work experiences. So it is a very heavy focus for the Department of Labor, and hence a focus of ours. So something we're working really hard to meet. And you can see on the left-hand side, there are a lot of things we can cover under those work experience expenditures. So just spending time with a youth and really helping them understand what's employability, what's career exploration, all of those things would fall under a work experience expenditure. On the next slide, it just talks about how we really look at work experience opportunities for young people or even adults. We really take the time to sit down with that individual and go through career exploration, really focusing on career pathways. We really try to engage our businesses to offer tours, to meet with these young people or even those adults to say, how do things work here at this organization? We look at job shadowing. We really want the individual to experience everything they can before going to work there or having a work experience. So the very last slide just kind of summarizes the benefits to an OJT or work experience and kind of gives some data. So if you really look, the very first thing talks about the participants. Again, it's really just about training them so that they can enter the workforce and have a self-sustainable wage for a long period of time. So a permanent employment position. For the employer, it's really about having maybe a temporary worker at little to no cost. More importantly, moving into a permanent position. And then very lastly, just really helping build our community. And so being engaged with that community-minded piece. Really, that is my piece, and I really wanted to turn it over to Nikki. As I mentioned, she works for our division as well, but she works with the Division of Vocational Rehabilitation. And so her program's similar, but different because she reports to the Department of Education.
Senator Murphy.
Thank you, Madam Chair. Let me ask, how are you getting the word out to youth? This looks like a great program for them, but I wasn't aware of it, and I'm wondering how we're marketing this and getting youth involved in the program. Thank you.
Ms. West.
Madam Chair and committee members, you hit the nail on the head. This is a struggle. We really need our community. And I think this is where we need your help to get the word out. We need businesses to know about that. I would love, as there's a lot of questions about WIOA, I would love to have captive audiences like this to talk about all the services we can provide. I think there's lots of things that people don't know. And we just really want to share that. So you're right, that's that missing link. And we are really working hard as an agency to take every opportunity we can, but we also need your help.
Can't you put flyers in the periodic mailings to employers to dun them for their work unemployment compensation premiums or something? Oh. Representative Odman.
Madam Chairman, Christina, I was just wondering, is this done I was at a meeting yesterday where people were saying, you know what, we have too many separate entities and we need to combine forces so that we're not duplicating and spending a lot of funds. Is this primarily state-run from the top, or do the Department of Workforce Services in individual counties have all of this information and are advertising themselves, or how's that work?
Ms.
Thank you.
West.
Madam Chair and committee members, that's a really great question. We actually, it's a statewide federal program. So all the rules and expectations and measures that we're held accountable to are the same statewide. And so we are doing the big push, from, I guess, kind of top down, but they also have all of the marketing materials and those pieces to make that push themselves. So it's a little bit of both. We're doing it, but then, we also know that each county or each workforce center does it as well. So for example, we've got Wheatland and Torrington, they know their community. They're going out and making those pushes and talking to the school districts and talking to, those areas themselves, but we're also doing it, at a big, more global level. Mhm.
Representative Flitner.
Thank you, Madam Chairman, and Ms. West, thank you. So walk me through the process. I'm an employer. We have an 8th grade boy that just started working with us. Yesterday, he had his 30-second lesson on how to drive the front end loader. So, yeah, exactly. It's extremely hazardous. Anyway, maybe I just was curious what's involved with, as an employer, about signing up, what are the hoops involved and the strings attached?
Madam Chair and committee members, again, that's a really great question. So we provided the map of the 20 workforce centers. I would love to talk to you and find out where you're located. We would want to get you connected with the workforce centers. And we actually have business reps and we have case managers, and they work really closely together. The business reps work really directly with the businesses, the employers, to really address lots of things, open jobs, job fairs, all of those real basic things. But we would have you work directly with that case manager. We would get that youth and that parent in. We would just sit down and have a meeting talking about what their barriers are, how that individual is doing in school, what's their employability skills, have they ever worked before? So really just a basic assessment. And then from there, we would determine eligibility for WIOA so that we could move forward and get that youth enrolled in our youth program at the local workforce center. The local workforce centers are required for the youth program to always develop or deliver what we call the 14 program elements. And I briefly mentioned that on a slide, but then it's very individualized. It's based on that youth and what they need. And they work directly with that case manager, meeting with them usually about every 60 days as they're working on lots of different activities. In our youth programs, we can provide incentives and bonuses. So as they're working through their education or they're getting their high set, we can pay them as they learn. We can pay stipends to encourage them to continue working on certain things. This is all built into the WIOA program. So I would love to talk to you more. Lots of fun things.
Break is almost coming up. Representative Stiver, did you have a question?
Yes, Madam Chairman. Ms. West, how many employers are really on board with this? This kind of reminds me of a program, VEEP, back in the early 90s that nobody would take.
Ms. West.
Madam Chair and committee members, I don't actually have numbers in front of me as far as how many people we have in posting jobs in Wyoming at work or working directly with us. I will say the work experiences at times can be really hard getting the businesses to say yes, only because, it's great, but it's also a little work for them, right? I mean, they're providing a learning opportunity for that youth. They have to pay the salary and we reimburse them. And so depending on that business, that could be difficult. However, as I said, we have a lot of fun ways that the Department of Labor allows us to navigate and So we've kind of have found ways around that, where we can pay that individual a stipend. And so it takes some of the weight off of the business. So again, it really depends. I think in some areas, there's more buy-in. Other areas just don't know anything about it. And so we need to get that word out to them.
Ms. West, could you take sort of a guess? I mean, like 50 employers or 5,000 employers, or, I mean, like.
I mean, I guess I would say, for example, Madam Chairman and committee members, I would say, for example, Sheridan County, they are probably the ones that are most engaged. And I would say we probably have about 35 that are they're not necessarily actively in a work experience, but they have taken youth in the past and would be willing to do that now.
Okay. More questions? Representative Romero Martinez.
Thank you, Madam Chair, for letting me borrow your microphone too.
We're sharing.
So just a comment, when this first came out in 2014, I remember because there was a deal at Wyoming Workforce Center in Cheyenne, and they actually had an application. Do you have an idea for Wyoming Innovation, WIOA? And I remember spending a great deal of time writing some pretty well thought paragraphs on what I thought would be innovative concepts. I never heard back from the program. So I think part of the thing is follow-up. I mean, maybe my idea sucked or was not, maybe that's not the good word order. Maybe my idea was, I mean, I think it was well thought out, that they had to do with innovation in medicine and innovation in technology. I think part of this whole program came out when the federal government at that time was talking about retooling. And of course, we're talking about retooling with jobs of the future. And as we see, some of our new companies popping up in relation to technology, it was there for that reason. And I don't know if I have a question. I guess I wanted to make that comment, and then I guess just make the suggestion that maybe we could do a better job with follow-up. And if there's something we could do, maybe we could even have a better relationship between representatives and what you all are doing to make sure that it flies better. Was at Workforce Center yesterday also. I've never seen a flyer on this one. You hear about it, it's on the website, it's a hyperlink. It's just not being pushed. And I'm not saying anybody's fault per se, but I'm open to ideas on it. Just come up a couple of comments, and I appreciate what you're doing.
Thank you.
Ms. West.
Mrs. Chairman and committee members, thank you for those comments. And you're right, I do think there are things that we need to do to push a little bit harder to get that information out. But again, I would love to visit with you and kind of talk about that, because you're right, there's a lot of retooling, and we are working closely with NextGen. And I think those are the types of things that we need to look at as we're looking at work experiences and strengthening our youth. So I would love to visit.
Okay. Ms. Harper, I think you're up.
Madam Chair, members of the committee, thank you. As I mentioned, I'm Nikki Harper with the Division of Vocational Rehabilitation. So since you asked the question earlier, Madam Chair, on how we are funded, I thought I would mention too, it's not on the slide. If we can go to the next slide, please. Next slide. Vocational rehabilitation is mostly federally funded. We're 80% federally funded with a 20% state match. And at the federal level, like Christina said, we are housed under the Department of Education. In Wyoming, we are fortunate to be housed with DWS with our Title I and III partners. So vocational rehabilitation, we assist individuals with disabilities or a potential disability in obtaining, maintaining, preparing for, or in advancing in employment. Like Christina mentioned, we too have 16 field officers across the state, where in 16 of those locations that she has officers, we are co-located. We have 20 satellite officers and 28 counselors. And the vocational rehabilitation program has actually been around for the last 100 years. Actually, we're celebrating 101 years this year. We were hoping to have a big party last year, but COVID kind of messed it up for all of us.
We'll let you bring cake this afternoon.
Okay. Next slide, please. So I would like to talk a little bit more about work experiences for vocational rehabilitation clients. Like Christina mentioned, the significant benefits for our clients, and I want to touch a little bit on the benefits for the employers as well. So we all know that a paid or unpaid opportunity provides just the hands-on experiences and the exposure for our youth and our clients to make better informed decisions when it comes to future career choices. And in vocational rehabilitation, our clients can, youth or adults can qualify for a work experience, and they're typically short-term in nature. So anywhere from 2 weeks to 2 months. It's really based upon individual need, based upon employer need, based upon if the client is gaining a skill set, what they're learning. We also like work experiences because the individual gets to have that hands-on tangible experience. And it's a little different sometimes from what you get on a skills assessment that they may do in school. Our counselors are in all 48 school districts. So we work very closely in a collaborative manner with school districts and the community colleges. And frequently you get, skill-based assessments or career assessments done, but sometimes the assessment doesn't always line up with what the student wants to do with a hands-on tangible experience. And we've also found that making work-based learning experiences available to our students and adults have indicated that there's more longevity in employment because clearly there's a better match or it was a more suitable job for them. And as a result, we find that returning clients are, meaning coming back for services, are lessened. So doing that work experience upfront in the long run actually pays off for the client and for the division. And for students, as most of you probably know or have heard that, especially for students with disabilities, work experience during high school is actually a strong predictor of employment and higher wages after high school. So that is why, like I said, we are in all 48 school districts working very closely. A little bit challenging because 48 school districts do things 48 different ways. So trying to make sure that we're following federal and state guidelines across the board does get challenging, but we navigate the waters. And also with the work experience, sometimes it's not just about the employment itself. It's about our clients developing those soft skills, which today's youth, I'm sorry to say, I have one of those too. It's like, don't wear your hat sideways, show up on time, pull up your pants, don't have an attitude, just those basic soft skills. So sometimes that's also what they're learning on the job and, learning about teamwork, learning about critical thinking, learning about, how do I problem solve? For individuals with disabilities, it's about how do I advocate for my needs? So on the flip side, as much as this is for our clients, it's beneficial for employers as well. We believe that it gives the opportunity for an employer to have an opportunity to build a robust talent pipeline and to get maybe kind of a look or a test drive to a potential employee. So they get to see if the employee is working out for them. And I know in Christina's program, sometimes the wages are reimbursed. In our case, the client is paid directly. So there is no commitment on the employer's part where they have to wait for the wage to be reimbursed. We take care of all the paperwork up front. Workers' compensation is paid by us. The client is paid by us. If the client needs additional supports on the work site, that is provided by us as well. So for instance, if an employer needs assistive technology assessment or an ADA assessment, because sometimes individuals are a little bit nervous when they say working with individuals with disability, they think, oh my gosh, that's going to cost me a whole lot. And in fact, research shows that most accommodations are under $500 and the VR staff person is trained to go in and do an assessment and provide that training if needed. Our staff can also provide disability etiquette training to employers, to organizations if need be. And again, kind of going back to really trying to work in collaboration with Christina's program, community members trying to be at, the word's not coming to me. What do the communities have, like where we meet after work? What's the work I'm looking for? After hours, yeah. What is it called? What is it? I'm sorry.
Business after hours.
Yes, business after hours. I'm sorry. It just didn't come to me.
Many thoughts came to mind, but it was best if we didn't. Go ahead, Ms. Harper.
Sorry about that. Okay, Madam Chair, getting back on track. If we can move to the next slide. So the VR program, we strongly believe that individuals with disabilities are really an untapped talent pool of skilled employees. We know that many employers are struggling to find employees to return back to work, or finding that they don't have the necessary skill sets to complete the work that needs to be done. And we believe that we can solve that problem, but with the number of clients that we have. So vocational rehab, as an employer, we try to be the choice and model agency when it comes to employment and inclusion. And we serve as a key provider to both employees and employers by providing youth and adults with paid work experiences. And most recently, we had the opportunity to collaborate again with Christina's program, because during COVID, we all know that the workforce centers just had high traffic. The walk-in traffic was significant, and trying to provide services to all Wyoming citizens who needed the services due to unemployment or other community-based resources got really challenging. So we saw that as an opportunity to not only help the agency, but also give our clients some opportunities to potentially work in state government. So in collaboration, we were able to place 14, if we can move to the next slide, please. We were able to place 14 clients with DWS workforce centers. And of the 14 clients, when there were a couple of retirements, 2 of the work experiences were turned into full-time employment. So now they are DWS employees, which is just really exciting, because the centers had the opportunity to see what skill sets these clients had, and that they'd already kind of, like I said, kind of had able to do a test run. So they were a really good match for the office. So across the state, I just want to really show really quickly too, that we have numerous work experiences all over the state. And I think the question had been asked, how many employers Christina had. I think it's a little bit easier for us to recruit employers, potentially because there's the employer doesn't have to do the paying upfront, that we take care of all that. So we have work experiences with the university, community colleges, with public libraries, medical facilities, big box stores, small mom and pop stores, just across the board. But one I wanted to highlight really quickly, because we're here in Riverton, was the collaboration we have with Tribal Vocational Rehabilitation, INTT skills trainers, and the Wyoming Indian High School. It's something we have developed with the casinos down here in Lander, where students have the opportunity to work in a variety of these settings, where they can try housekeeping, laundry, beverage service, work in administrative support positions. And frequently those work experiences have turned into paid employment for students. And we have a lot of community buy-in and community partnerships where they assist with transporting the students, where they learn soft skills while they're also learning the work skills. So they have that earn and learn kind of opportunity, which, like I said, is really exciting. And we have several of those kind of programs around the state, but I just wanted to highlight that for a moment. And I just want to, in the next slide, just give you a quick caption of some data, and we do have a little bit of a typo. So in 2019, pre-COVID, we had 130 youth placed in work experiences, and for adults, it's actually 135 adults. I'm sorry about that, not 35. And then last year, I guess, despite COVID, we were able to place 117 youth in work experiences and 112 adults. This year, we're doing pretty well, 110 youth and 89 adults. And we're hoping, with the economy opening back up, folks looking for employees, I think people with some sense of getting back to normalcy, that we will be able to have more opportunities for work experiences in the communities, and those numbers should go up by the end of the fiscal year. In conclusion, I just wanted to mention that work experiences and OJTs are not only valuable just to our clients and our participants, but they're also really an important community building tool that we as workforce centers use to strengthen our relationships with employers and community members. Like Christina mentioned, these are federally mandated programs, and we're just looking to y'all to give us ideas, supports, how to reach out, how to collaborate, how to get the word out. We are mandated to spend a certain dollar amount, and in a state like Wyoming, where we don't have the population or we don't have a certain student body with disabilities or a certain number of students or employers who are willing to come on board, we need all the support we can get, and we're open to ideas and discussions. Thank you, and I am going to turn it over to Shay unless y'all have any questions for me.
Senator Furphy.
Thank you, Madam Chair. Let me ask, are there funds available either through the federal government, et cetera, for an employer to adapt equipment to a worker with disabilities? So it may be quite expensive to do so.
Madam Chair, members of the committee, absolutely. If that individual is a client of ours, or if they're not a client and you just simply call up one of our officers and say, this individual has a disability, we need to adapt equipment for them so they can maintain their job or progress in their job. Those services will be covered, especially that will be considered rehabilitation technology, and it is in the law that we have to assist with covering rehab technology. So, yeah, thank you.
Representative Ottman.
Thank you, Madam Chair, and Nikki, thank you. I'm kind of interested in this for a few reasons, and I have a couple questions, but I think I'll just kind of peel them out to you and you can answer. Number one, you said that you're mandated to spend so much. Does that mean that the program then is discontinued if you don't? And I would like to know that amount. I'd also like to know how many people are in your group or underneath you to put this into effect. The other thing I would like to know is that years ago, they used to have a thing called home ec. And working in a school, I saw that now it's turned over to life skills and teaching people how to take care of their person and be health-wise and cleanliness, take care of a home. So now is that mandated by the federal government that we help people? And also, if these people are getting paid till they have a certain skill set, how long can they be temporary employees? And also, who keeps track of, do they really show up? Are they provided transportation? That'll probably.
Let's stop there for what?
Yeah.
Just so that you can.
Okay.
Go ahead, Ms. Harper.
Let me back up. When I said we are federally mandated, so we are federally mandated to provide what they call pre-employment transition services. And those services are to students and youth between the ages of 14 and 21. And we have to spend 15% of our budget on certain services, 5 services that fall under pre-employment transition services, and work-based learning is one of those services.
Okay.
So, and if we don't spend it, the feds don't like it if we don't spend the money. So we have, our program has to do what we called a maintenance of effort, where we have to spend a certain amount that we spent 2 years prior. So it makes it fairly challenging. And our program also has a state match. So we have to, thank goodness we have a good fiscal team who does the juggling act of balancing that. And they just tell me, you are underspent or you're getting close. So we monitor that fairly closely. And when you said how many people do we have, do you mean how many staff that we have or how many clients do we serve?
Actually, both.
Okay, so we have 28 VR counselors across the state, and we have 16 support staff. But what we do is we contract out with community rehabilitation providers. We sometimes have memorandums of understanding with the Department of Education. We work pretty closely with the Department of Health. So a lot of collaborative services sometimes to get the students or clients' needs met. For instance, if a client is a service recipient of the Department of Health under DD waiver services, The waiver services might provide the transportation, and we might provide the job coaching to make sure that the client is there, that they're doing what needs to be done, that the employer, if the employer is having some difficulty making sure they understand the directives given to them, that we're able to break it down for them. Did that answer that question? And then in terms of clients, right now we have, I don't have my numbers current as of yesterday, but as of last month, we had, I believe, over 850 pre-ed students, and our current overall clients are starting to increase a little bit, and we're sitting right at about 3,000 individuals with disabilities across the state of Wyoming. And I believe your other question was, how do they determine that the skills have been learned? Is that correct? Okay, so depending on the job, usually there is a teacher from the school district or a paraeducator from the school district or a job coach that we have contracted with that's been in communication with the employer, with the student, with a guardian or whoever who's serving for that client as a team, and jobs are identified or the skills will be identified. At week 1, you typically need to be here. Week 2, you need to be here. So there's an outline or progression of skill development that we would expect some, for clients to gain. Unfortunately, some clients takes, like you said, 30 something times to learn to, to do a certain skill. And some folks, it's may not necessarily be a learning disability or may not be an intellectual disability. So maybe they might learn hands-on a little bit faster. So based upon the client's disability and individual skill set and strengths, that may differ from person to person.
Representative Ottman.
Yes, is there a report that comes out of your office that shows how much administration costs there are and how much money is brought in and how much is spent on the clients?
We sure do, ma'am. And we can get that information to you. I have some very rough numbers here if we're specifically just talking about work experiences. So I can tell you in terms of what was paid out for work experience for wages, but I can get the additional administrative costs to you another time. So for wages in 2019 for youth, we paid out $124,287. For adults, we paid out $158,227. In 2020, for youth, we paid out $131,311. For adults, we paid out $122,185. And in 2021, we have paid out $162,824 for youth and $132,659 for adults. Yes, and like Christina mentioned too, the wage sometimes differs. So if it's an entry-level job, it'll be pretty much minimum wage. But if we're having a client do a job shadow or a work experience, maybe with an auto mechanic or maybe with maybe welding, so then we might not necessarily be paying industry wage, but they might be getting $15 an hour as opposed to the $7.50 an hour based on the nature of the work that they're doing. Thank you.
Representative Flitner.
Thank you, Madam Chairman, and thank you for the presentation. I appreciate it. 2 things. Liability risk. So for instance, if there's equipment that's broken because of a training experience, does the employer bear that, or is there a reimbursement? And then you also mentioned the state match. If you could speak to that, please.
Madam Chair, members of the committee, thank you for that question. Good question, because that does come up from employers. So for our work experience wages, they're typically paid out through an entity we contract with, Express Services. And within the contract, there's some language that's written, and I can't quote it off the top of my head, but essentially that if there's a worker-related injury, if there is anything that like an equipment breakdown or something like that, that will be paid for through the contract. So when we pay a wage of, let's say, $7.50, we're paying an administrative cost on top of that, which Representative Ottman was asking about, I believe is one of the questions you asked in terms of administrative cost. knock on wood, so far, we haven't had equipment malfunction or breakdown or an employer coming back to us to recoup lost revenue due to something like that. But like I said, that is all covered through the contract. But thank you for bringing that up, because now I'm going to go back and follow up to make sure we have some good, strong language to make sure that. In agriculture, we were just discussing something in Torrington, because we don't have, unfortunately, many youth that we can entice in the agriculture ranching kind of areas. We try to entice them with, this, you can continue to stay on here, learn these skills, get paid. And unfortunately, sad to say, some of the response we get is, I don't want to have, I want to leave. I'm not, I want to learn something in STEM related. I want to do technology. I want to work with computers. I want to be a superstar gamer or something like that. So we haven't had much with the, but I will definitely look into that. And your follow-up question, I'm sorry, the state match. So the state match is a federal requirement for the running of the programs. Like I mentioned, we are, to be accurate, 78% federally funded with 22% state dollars. So we just kind of say it breaks down to 4 state dollars, 4 federal dollars to 1 state dollar. So when we are paying for services, any services across the board, usually we're mostly utilizing federal dollars with that additional state match to cover the services. I'm not sure if I'm explaining that very well. So it goes from our staff wages to services provided to individuals with disabilities to contract services, just about anything and everything. And like with pre-ed services, like I mentioned, the 15%, most of those are completely federally funded. Thank you.
More questions for Ms. Harper? Okay, Ms. Moon, Representative Romero Martinez.
Thank you, Madam Chair. You had mentioned that you were looking for ideas for ways to collaborate. In my district, I know there's a variety of organizations that would be interested in collaborating, and I would be willing to engage in those ideas. And I just wanted to put that out there. And I appreciate your presentation. Thank you.
Madam Chair, Representative Romero Martinez, thank you so much. We will definitely be following up. Thank you.
Good.
Madam Chairman,
Ms. Moon.
this is Representative Clifford.
Great. Thank you, Madam Chairman, members of the committee. I am going to speak to our Workforce Development Training Fund. Oh, of course. So you can go ahead and progress to the next slide. So under our Workforce Development Training Fund, we have a variety of different grants that are available to businesses in order to train or upskill their workforce. We have the business training grants, the pre-hire grants, internship grants, and the apprenticeship grants. You can go ahead and move to the next slide. The business training grants are for businesses directly. They provide funding for their current employees to learn a new skill or retrain their current employees. Similar to many of our grants, this is a reimbursement funding model to the business. And funding limits range from $1,000 to $1,500 per trainee per state fiscal year. Employers can use this funding to increase skills or retrain their current employees. I want to go ahead and move to the next slide. Here's some data that was taken for the time period of July 1, 2019 to June 30, 2020, just showing individuals served under the business training grants. You'll see one of the data points that stands out is that there were 258 individuals served under a healthcare and social assistance, employer, and that may be in part due to heavy use from county hospitals or private practice clinics during that time. And if you want to progress to the next slide, this is just some more data about individuals served under the business training grants. And this is per county data. And we'll go ahead and move into the pre-hire grants. These grants are funded to address workforce shortages, and monies are reserved for potential employees to receive training for a specific skill set before they are placed in a job. So this particular grant kind of has several parts to it. Applications are completed through a partnership that includes the training entity, the business with a need for a worker with a specific skill, the local economic development entity, and the local workforce center to help with the placement of trainees and recruitment of potential skilled workers. There are no funding limits on this grant, and they are reviewed on a case-by-case basis. We're going to go ahead and move into some data on the pre-hire grants, number of trainees by industry. So you can kind of see there that in the construction, in the construction management industry, we have 160 trainees that were served during that time period, July 1, 2019 to June 30th, 2020.
Madam Chair.
Representative Hallinan.
Thank you, Madam Chair. I'm wondering why there's a real shortage in the number of nursing assistants and people of that sort. I only see that only 20 on here were shown to be trained. So I wonder why there isn't more, because there's a tremendous need for those kinds of people.
Ms. Moon.
Yeah, Madam Chair, members of the committee, that is a great question, and actually something that we have talked about just amongst my team and amongst others within the department. And I can't speak to necessarily this time frame and why that was, but I do know that we have more recently, since I've come into the unit, put some emphasis on healthcare in terms of these grants and usage, and with our apprenticeship grant as well.
Madam Chairman.
Representative Ottman.
Thank you. Just a comment on that. Here at CWC, we have
Could you move a
a
little
nursing,
closer to your?
here at CWC, we have a nursing program. And I know that a lot of young people are going through that with the Hathaway. So that may be one reason.
Yeah.
But when you were talking about networking or collaborating with other entities, all three of you, one of the things that I've noticed over the years, because my husband's into construction, is that the young people coming into those fields were not there. And they were all going into IT and different things like that. And what they were traditionally learning in high school, those shops were closed. The woodworking, the welding, the agriculture, all of that through the education department and through capital construction, different things, they were changed around and eliminated. So do your departments collaborate with the Department of Education to say, these are the skill sets we need to see in the workforce, and so you need to have some of them here, or at least not get rid of them. So thank you.
Ms. Moon.
In terms of my unit collaboration directly with the Department of Ed, I have not had much opportunity to do that since my time here. I do know Nikki's program, for example, with vocational rehabilitation, does collaborate with the Department of Ed.
Representative Ottman, I have heard in past years about the challenges, what with our expectations for testing of students in, math and English and such like that. They have tended to, there's only so much time in a day. And if the Department of Ed is going to reward or punish schools based on how well they're doing on English and math, they have less time to teach some other things. Just, there's a lot of consequences to things that we do often on the floor of the legislature. Were there more questions for Representative Connolly?
Thank you, Madam Chair. And it's just that I have a message from Representative Clifford that she has a question or comment, and I'm not exactly sure for whom.
Very good. Representative Clifford.
Me okay?
Yep.
Okay, cool.
Okay, if there's a lag, hang on one sec, Representative Clifford. Try talking now.
Okay. Thank you, Madam Chairman. Can you hear me okay?
We're not hearing you yet. Try talking again.
Madam Chairman, can you hear me okay?
Is there anything you can do to help us hear from Representative Clifford? Okay. Well, Katie, is there a way for her to, can she just call? I don't- Representative Connolly, did she text you? Can she just call your phone and you put her on speaker? Okay, try now, Representative Clifford. Oh, Representative Clifford, can you type your question into the chat bar?
Madam Chairman, Representative Clifford has called me.
Okay. Beam her away. Is it on, wait, she's not on speaker.
Okay, Representative Clifford, I think we can hear you now.
Can you hear me okay? Hello? Hello?
Andy, can you hear me? This is Kathy.
I can hear you. I'm gonna mute my computer. That's what's
Yeah,
wrong.
good.
Can you hear me okay?
Sounds like you're calling from a submarine, but that's okay. Tell her, try now.
Madam Chairman, can you hear me okay? Thank you. I just kind of wanted to comment on the last presentation. Sorry, you guys can't hear me, and thanks for accommodating me. I'm sorry I couldn't be there in person. I was fortunate enough to be a part of the Pathways implementation that came to the casino in my former job. So it was just getting a lot of people together, and I could talk to my colleague, Representative Romero Martinez, on how we rolled that out. I am a product from 14 years of age, doing OJT, workforce investment, getting job skills, working in the summer, during school, and gaining some work skills on the reservation since I was 14 years old. So I was a participant in federal programs since that time. And it is key, it is important, specifically to the reservation and its communities there. And since I was on the other side, the receiving end as of 14 years of age, I was able to observe a lot of the things that employers possibly didn't have the skills or the want to, I guess, the motivation, skills or motivation to really implement youth on the job trainings, the work experience. And so when I was fortunate enough to oversee, and we brought in 30 to 40 youth every summer, and we always made sure we would grab them from each of our Fremont County school districts to come into our programs at the casinos to experience the pathways or the OJT. And particularly, I'm very proud, we accommodated a lot of our students with disabilities. And so firsthand, this is good. And so it's important. It's a really good program. What I'm very proud of, to have worked with the workforce centers there in Fremont County, it's very crucial. And I can tell you, there are still participants who started in this program that are still working in their jobs when they started in pathways or on the job trainings. They're working. I have participants since the age of 14 that have participated along with me that got good jobs because of these programs, bought homes, and were able to buy vehicles. I've seen that with my own eyes. And so I'm just one that's very passionate about this. I know there's key concerns about budget, about possibly the federal government, but I wanted to share all the good that these programs do, particularly for the reservation, the only reservation in Wyoming that always has had over a 70% unemployment rate. Thank you very much, Madam Chairman.
Thank you, Representative Clifford, very much. Thanks for being patient while we figured out how to plug you in there. Okay, Ms. Moon. Oh,
Madam
Director
Chairman.
Cooley.
Madam Chairman, I just wanted to respond to the question also from Representative Ott as it relates to that relationship between our training fund and all of our programs actually in alignment with the needs of our communities and the needs that we're seeing, whether it's agriculture, whether it's the CNAs. Representative Connolly, I know, is on the Education Attainment Council, and in my estimation, there has been more collaboration, not only with the Department of Education, but also the Community College Commission, the Community Colleges, Community College Commission, and UW around this alignment and the pathway, the alignment as it relates to what are the needs we're seeing, whether it's CNAs, it's more individuals in healthcare, it's more individuals in agriculture, that alignment and those pathways and recognizing the training they need as it relates to the needs of the employers, that collaboration and communication is definitely ongoing and in my estimation is increasing as we move forward. So I just wanted to throw that out there for you as well.
Yeah, thank you.
Okay, Ms. Moon, do you have some more to tell us about?
I do. If you want to go ahead and move to the next slide, we will dive into internship grants. This is one of our more popular grants and also one of our newer grants. This program provides funds to offer structured learning experiences that enhance work skills, knowledge, and abilities of the intern. This program in particular allows reimbursement for up to $12 an hour for up to 1,040 hours per intern per state fiscal year. If you want to go ahead and move to the next slide. We do have some data here on number of interns by industry. You can see here that there's, a number of these under the technology industry, which is a direct reflection of our work with a tech company here in Wyoming. So, and some interns that they had under them. So if you want to go ahead and move to the next slide. So we have an apprenticeship grant that's under the Workforce Development Training Fund. And we also have an apprenticeship grant that is separate from that, that I will speak to here in a slide or two. They are different, but they do work together very well, and we can layer those and cover different costs for the business. So a lot of you have probably heard about apprenticeships. It's a very big topic, one that is discussed often in different workforce groups. So just to kind of give you an idea about the components of a registered apprenticeship and what that looks like, there is structured on-the-job learning with mentoring. There's related training and instruction as part of that. It's an earn and learn model, earning wages while you're on the job. And it does provide at the end of the apprenticeship, the National Occupational Credential that is recognized by the industry. And generally, there's some sort of reward for skill gain. So increased skill would equal increased earning for the apprentice. So our apprenticeship grant under the Workforce Development Training Fund is one that covers the costs of related instruction of the structured training. There are no limits on that for amounts, but it is a reimbursement for the training related costs. And this can be tuition, it can be books and other related materials, depending on what the need is. So if you want to go ahead and go to the next slide, here's some data on apprenticeships. Number of apprentices by industry. Again, this data is from July of 2019 to June of 2020. And you'll see, tech again is you're going to see some higher numbers in technology, but also in HVAC and plumbing as well. We do happen to work with a community college in Wyoming who does offer apprenticeships quite often in those industries. So if you go ahead and move to this last slide I have, this talks about our apprenticeship state expansion grant. And this is a grant that the Department of Workforce Services received from the U.S. Department of Labor. It's a grant for a 3-year performance period from July 1 of 2019 to June 30th of 2022. We were awarded $641,000 for this apprenticeship grant. And this grant is also a reimbursement model, so it can reimburse for to the business for each. There's a flat rate for each apprentice that it's reimbursed for. So this can go hand in hand with the other apprenticeship grant under our Workforce Development Training Fund as well. And so both of the employee, there can be a reimbursement per apprentice, and then the related instruction costs are also covered under that Workforce Development Training Fund grant, apprenticeship grant. That is all that I have today about our apprenticeships and our Workforce Development Training Fund. Please let me know if you have any questions and I'll be happy to answer those.
Questions for Ms. Moon? Senator Hutchings.
Thank you, Madam Chair. Shay, thank you for that presentation. Just a quick question on what are the requirements to get into this program where you're paying for tuition, books, you're paying the employer, if I have that correct?
Absolutely. We have an application process. The applications look a little differently depending on the grant. But we do have that process of the application where the business will fill out that application with the help of our lead on the grants, can help them through that process. It's really just a matter of kind of what the business is wanting to do, what that looks like, whether it's, what training grant that there is going to best fit their needs. Sometimes we have businesses reach out to us, but they don't really know which grant is going to best work for them. So we will help guide them through that process. But there is an application process, and then we just walk the business through that.
Thank you, Madam Chair. Follow-up question. These grants are for the businesses to apply for. We have Department of Health or Labor, Department of Education. Where is the money coming from for these grants?
So in particular for the Workforce Development Training Fund, that funding comes directly off the interest from the UI training or the UI Trust Fund. I'm sorry, I apologize. That comes from the interest off the UI Trust Fund. For the apprenticeship expansion grant, that is just money that was awarded directly from the Department of Labor. So that is separate.
The UI Trust Fund, Madam Chair. I'm not familiar with that.
I assume they mean unemployment insurance.
Unemployment, okay.
Thank you.
Thank you.
Any more follow-up?
No, ma'am.
Make sure to turn off your mic then. Representative Hallinan?
Thank you, Madam Chair. Ms. Moore, I noticed that HVAC has 40 apprenticeships. My son took an apprenticeship in HVAC. He did it in Colorado. He didn't take part of this program, but I wish he had. I think it takes about 2 years is how long that apprenticeship was. Does your program cover for that entire 2 years?
Just 1 second. Yes, I believe that it would. Madam Chairman, members of the committee, yes, I do believe it does cover that time frame.
Okay, and my follow-up on that would be, I think there's a tremendous need for HVAC employees around our state, around the country. Is that something that you use in deciding on how many of these apprenticeships are you going to grant to use the need for that type of employee in granting these apprenticeships?
Yes, ma'am.
Absolutely. We also work closely with the Wyoming Workforce Development Council who to approve these grants. So that is taken into consideration, industry need, where we're spending, where are we spending most of the funding? Do we need to sort of diversify that, look at other, options to award for that? But it is really based on industry need and in our communities in Wyoming.
Okay. Representative Romero Martinez.
Thank you, Madam Chair. Ms. Moon, I know that in my district, in my community, this is also something that could benefit a lot of the citizens there. And I see that there's, some areas that need improvement, just like in all of our projects with the state. But I noticed that there was only 1 in civil engineering and then 8 in electrical. And I'm sure those numbers are going to go up because I think those two, in agreement with my colleague, Representative Hallinan, I could see the need for HVAC, but they all kind of work together. And with the electrical, since usually that's a low voltage license, that's also the same license that's needed in IT oftentimes. And you had mentioned one of your partner employers. My experience with that employer is 1 star. So sorry to express, but there's others out there too. But then I've recently given 1 star to one of them. Also, I won't name their name this time because they're my employer and they know who they are. The point I wanted to make is with company X, whoever it is, because there's more than 2 out there. Obviously, we have I want to say habit of using temp agencies. And these temp agencies may have so many hours that they want you to work before they consider you for employment. But most of the time, what's happening is they're practicing employee recycling. So one day they're at Lowe's Distribution. Next thing you know, they're at Sierra. Next thing, and it rotates in a circle. I'm looking for a solution here. One of the companies, senior area managers mentioned to me that they've been wanting for a long time to include basically what's the equivalent of a skilled program. Most of them don't have that. So I guess a little bit of a gray area where I think maybe we could strengthen this. And then I also I was listening to my colleague who we just heard from through the cell phone, Representative Clifford, if we could learn from her positive experience with the reservation. I'm sure my district and my community would have a good response when we engage the leaders within the various organizations. And I'm sure that's true for every member here in this panel. And I think we could really maybe be more effective if we all participated, obviously after hours, after the committee. But no, just a couple of comments, and I appreciate the information. It's really enlightening to me. Thank you.
Thank you so much.
Okay. Any other questions? Sorry, not quite mastered this yet. Ms. Moon, thank you very much. Workforce Services. Okay, committee, we're as typical on the Labor Committee, running about 45 minutes behind. So I'm going to move the break forward just because some people may be wanting a break by now and shorten it. So if we could come back at 20 till, and then we will pick up with the governor's office at 10:40. Please be concise so we can try to stay on task. Thank you.
Hi, this is Jamie. Can you hear me in Riverton?
Hi, Jamie. Yes, we're hearing you now. Thank you.
Okay, thanks.
Test, yep.
Hi, this is Jamie. Can you hear me in Riverton? Yeah, you're welcome.
Okay, committee, as we're making our way back to our seats, a couple of announcements. One is that, and we want to thank the Central Wyoming College for their space. It's lovely and we're glad to be here. They would like to let us know that the food court here is open for lunch today. It will not be open tomorrow, but it is open today. And it's in the next building over. I think he pointed that way, right? That way. Out the door to the left. The food court is available today. Another announcement, folks, for you tomorrow morning. So we are scheduled to begin at 8 o'clock tomorrow morning. Members, could you please listen to the announcements? We are scheduled to start the meeting tomorrow at 8 o'clock, but the college would like to let us know that tomorrow at 8 at the flagpole, which is also out that way, they are having a flag ceremony to honor Tim Hart, the Cody firefighter who was killed recently fighting a fire in New Mexico. So if you would like to participate with them gathering around the flagpole for that tomorrow, if you could be there a few minutes before 8 o'clock, just so that we're all in place at 8. And it's just a brief ceremony with the flag to honor Mr. Hart and his service. And then we'll come in. So we probably won't actually start in here until maybe 8:05 roughly by the time we get in. So if you want to do that tomorrow, that'd be great. So moving on.
Madam Chairman,
Yes.
I would just, I guess, public comment, if you want to make that available for the topics that the committee has already addressed.
Okay. Thank you for that reminder, Mr. Brody. And I had another announcement. For Representative Clifford, we think we have finished we have taken care of the technical difficulty. So actually, if you would attempt to make a public comment right now, just so that we can test that, would you just try to tell us something about how we're doing?
Thank you, Madam Chairman. Can you hear me?
Oh, good. We can hear you. Yay. Super. Okay. All right. Was there any public comment on this morning's workforce services topics?
And then, Madam Chairman, just for those on Zoom, if you could raise your hand, that
Yes.
would allow us to know if you want to speak.
Is there anyone on Zoom who wishes to comment on the workforce services topics?
I'm letting them in now.
There are some, huh? Okay.
Mr.
I see
Santini
Mr.
and
Santini.
Ms. Johnson.
Okay, Mr. Santini.
Thank you, Madam Chairman. This is George Santini. I'll turn on my video. I managed to find a coat and a tie so I won't be totally out of place. I wanted to talk to the committee a little bit about some of the issues that you were discussing earlier today. Particularly, I'd like to talk to you about the opt-in, opt-out provisions of the workers' compensation system, how private insurance works in workers' compensation, what other states do as far as coverage of employees, and how Wyoming is unique among all states in the manner in which it decides which employees are covered or not covered. I would start off by pointing out that Wyoming's workers' compensation system is a constitutionally created system. It is not legislatively created. It is created as a matter of constitution in Wyoming under Article 10, Section 4 of the Wyoming Constitution. That particular provision of the Constitution was passed back in the early 1990s, 1910s, and provided that in exchange for the right to receive workers' compensation benefits, injured workers would give up their common law rights of suit against their employers. In exchange, the employers would receive immunity from all suits from their employees for any work-related accidents or injuries. That is what's called the grand bargain. Now, in Wyoming, the constitutional provision provides that for all extra hazardous occupations, the legislature will provide for the creation of a fund to be funded through payments or premiums paid by employers, and then administered through the state, at that time, the state treasurer's office, to pay benefits to injured workers, including payment of their medical expenses, some limited wage loss, and some disability. And that's a nutshell of what workers' compensation is all about. Now, Wyoming, like most states at that time, decided that in order to create this workers' compensation system, we have to decide which employees are going to be covered or not covered. So Wyoming had, for up until 1991, a system where they had a laundry list of particular employment occupations which would receive workers' compensation coverage. And those occupations, regardless of what the general industry was that the employer was in, would be entitled to be covered under workers' compensation, and their employers would have to pay premiums into the workers' compensation system. For example, prior to 1991, hotel maids and janitors were not listed specifically under household services, but in that year they decided, yes, we ought to include hotel maids and janitors. But what happened in '91 was that the workers' compensation system was changed fundamentally, in that it went away from a list of extra hazardous occupations to where it went to an employer classification system where who was supposed to participate in workers' compensation was decided not by what job you held individually, but by what industry your employer was in. For example, there's case law of the Wyoming Supreme Court where a warehouse worker working at a Walmart warehouse here in Cheyenne was denied workers' compensation benefits because it was assumed that the primary business of Walmart is retail, not operating a warehouse. That's how the system works. Now, I joined a little late and I apologize. So I didn't see the division's presentation as to the number of employers who have opted into the system, who are not deemed extra hazardous occupations. But I can tell you from my personal experience and my practice, I've represented both employers and employees in those types of cases. And in general, the level of benefits in those sort of programs where you're not opting into the Wyoming Workers' Compensation Act, those level of benefits are determined entirely by the insurer or the employee or the employer. I can tell you, for example, that Walmart has a workers' compensation program that they call the Walmart Workers' Compensation Program that essentially provides limits in the duration of medical expenses that they'll pay, about half the amount of indemnity benefits that employees receive as compared to the Wyoming Act, and essentially gives the employee far less benefits if they take those workers' compensation benefits than they would receive had Walmart been covered under the Wyoming Workers' Compensation Act. Now, Wyoming remains unique among all states in that the vast majority of states, with possible exception of Texas, which has an opt-in, opt-out provision where the employee can either opt into workers' compensation coverage or opt out at the time of injury. All other states cover all employees. It's universal coverage. And the way it works is that in most states, other than Wyoming, because we have a monopoly system, you purchase workers' compensation coverage. Employers purchase workers' compensation coverage in the public market, and the amount of the premiums established between the employer and their insurance company. The level of benefits is established by state law, and the state normally provides some mechanism of enforcement between the insurer and the injured worker in the event of a work-related accident. Wyoming's different because both the insurer, in this case, the Wyoming Workers' Compensation Safety Division, and the administrator of the Workers' Compensation Program are the same people. So Wyoming's a little different and it's unique. When there is this type of private insurance that we have where employers have opted out of the Wyoming Workers' Compensation system, those employees will be required to, one, accept a lower level of benefits, and two, even if they accept that lower level of benefits, they will be asked or given the option, you can either release your employer from all potential liability that they may have, or receive workers' compensation benefits. You can't do both. They're required to sign sign an election of remedies that they can either elect to receive workers' compensation or sue their employer, or they're not going to get any coverage. Back in, I hate to date myself like this, but back in '93, I represented some Walmart employees who were injured on the job and denied benefits. At that point, we went into federal court and were able to establish the fact that these employer benefit plans outside of the Wyoming Workers' Compensation Act are governed under a law called ERISA, Employee Retirement and Security Act. But the effect of that decision was that the employer who opts out of the workers' compensation system in Wyoming has carte blanche to write their own program. They can decide that their program could be half of Wyoming's level. They could decide to make it twice Wyoming's level, but they are not governed under the benefit provisions of the Wyoming Workers' Compensation Act and do not necessarily receive the immunity of the Wyoming Workers' Compensation Act. What I will let the committee know, Madam Chairman, is that I'll be happy to answer any questions that you might have. I don't know if any of the members of the committee were around in 2009 when then Chairman Scott and I think it was Fred Parody held a series of public meetings. At that time, I appeared before the committee, and I think we spent about 3 hours talking about workers' compensation issues, and I'd be happy to do that again if the committee would like.
I hope not. Any questions for Mr. Santini? None. Well, none at the time, but I am pretty sure that I don't know if you heard us make the request to the agency for some further information. We'll probably be back on the agenda in September. Thank you, Mr. Santini, very much.
Thank you, Madam Chairman.
Katie, who was the other person that we had on?
Ms. Johnson.
Ms. Johnson.
Good morning, Madam Chair and members of the committee. My name is Tammy Johnson, and I am the Executive Secretary for Wyoming State AFL-CIO. You can imagine that our workers have a great interest in how workers' compensation works in the state. There's always a lot of narratives to tell, but the presumption that was passed last fall was absolutely necessary, and I thank you and the legislature for the work on that. The interesting piece of that is some of our most highly exposed workers in the state who were probably could have been classified as in a super spreader situation were grocery store workers who fall under private carrier workers' compensation. There's a few that are covered under the state system, but most grocery stores in the state are under private carrier. And so here you had a group of people who were highly exposed, who don't make a wage that's high enough for them to follow a lawsuit that may prove that they were sick or they were infected at work. And so who probably continue to go to work if they were sick because they need to eat and they need to pay their bills and feed their family. I'm not saying that that happened, but that's the scenario that we establish when that group of workers wasn't afforded the presumption if they were not in the Wyoming workers' comp system. So we made some great progress, and I thank you for that statute, but we need to consider it more broadly and think about that, how our state functions during COVID and what we might have done to protect the community more. I would like to ask that as this committee moves forward, we consider some more of those NACE codes and broadening, much like Mr. Santini said, broadening our workers' comp coverage in the state system so that many groups of people can have coverage that's afforded. The ability of the employee to, under a private insurance carrier, the ability of an employee to obtain services is very difficult. If I work at a place where a private carrier has the workers' comp insurance, there are healthcare providers in this state who will not accept that coverage. So for them to go out and get medical services, they often can't do it because there are medical providers here who won't cover that. They will not accept the benefits that are provided from some employers under those private carriers. And under those carriers, it's important to understand too that the employee has no recourse if their claim is denied. They don't have the resources to pursue legal action, and they might not even have the, won't have the ability to do that. So looking at our workers' comp system and trying to figure out how we can constitutionally cover as many people as we can. And I would say, I guess when we think about COVID and we look at the nature of work now as to when, I think earlier in the meeting, it was mentioned that retailers are low risk. And it depends on what they're asked to do by their employer. If they're asked to lift boxes, stock shelves, wipe up wet floors, stand at a counter stand when there's a pandemic going, stand at a checkout line when there's a pandemic going, they are at a high risk. And so I think reassessing what we call risk is something that could be done as well. So, and one other thing, we've talked a little bit about schools and their coverage. And as you know, I have in the past worked for education and talked about the benefits for teachers. And it's interesting that some teachers are covered when others are not, when many teachers are susceptible to injury at school, particularly when COVID was on and there was COVID being spread, but other ways too. I was a high school teacher for 16 years and you're working with kids who are much bigger and much stronger than you, and at any time you could be hurt. But it would be interesting for the committee to find out what school districts pay in premium for some kind of liability protection versus what it would cost them to be in the plan, in the Wyoming workers' compensation plan for all their employees. So that's just a thought that I had. And you know, in the private situation, there's no forum for an injured employee to pursue if their claim is denied, if they're disputed. So we really put the employees who are covered under private insurance carrier at a huge disadvantage compared to those who are in the state system. They're not given those constitutional guarantees that those other workers are given. So anyway, I appreciate being able to testify this morning. I would like to offer the opportunity to gather together some of the state's experts on workers' comp, and perhaps we could be on the agenda for the next committee meeting and present to you. So thank you, Madam Chair.
Questions for Ms. Johnson? No, but thank you for that offer. Looks like this topic will certainly be moving forward.
Let me know.
Thank you very much.
I will keep in touch with you, Madam Chair, and see if that's something we should do for the next meeting.
Okay.
Thank
Katie,
you.
is there anyone else online? Okay, very good. Let's move on then. Where'd Miss Davis go? She gave up. No, there she is. Miss Davis. Well, we're only an hour and 15 minutes behind now. Costs of healthcare, Governor's Office update and priority on the task force and the ARP funding. Welcome.
Thank you. Thank you, Madam Chairwoman and committee members. Glad to be here today. I will try to keep it brief so that you guys can hopefully get back onto your agenda. So I just wanted to start off by sharing with the committee some of the information from the Governor's Health Task Force. I thought I would just give you some brief information about how the task force came about to where it is today, and then share some of the updates to the work that they're doing. So originally the task force started out when the governor created the 5 separate task force for COVID response. And we had a health COVID response task force that has now evolved into looking at the bigger issues of healthcare in Wyoming. So in that group, we have really wanted to ensure that we have a wide, diverse group of stakeholders that are working in a variety of different areas across the state in the aging population and primary care and specialty care, also in any of those service fields that help people with the social issues around healthcare as well. So we've been very intentional in trying to include a wide group of individuals to make sure that we're covering a wide scope of healthcare in Wyoming. Additionally, what we looked at in the original group who had been participating in the COVID task force is we came up with some discussion points to take forward to the governor to talk about healthcare in Wyoming. What was decided was to initially focus on cost. As we all know here, the cost of healthcare in Wyoming is very high. And so we thought that was a good place to start, which the governor agreed with as the starting point. As you all are also aware, you can't really talk about cost without talking about the other components of healthcare because it all rolls in together in that very complex system. I know you guys had a session a month or so ago talking about some of the complexities around the healthcare system in Wyoming and across the nation. So from that original group, what we did as we discussed cost was we broke it down into 4 subcategories, which ended up being separate subcommittees. One of them was focused on the aging population. As we know, that is a growing concern in our state as our population is getting older. I know that's also a topic that you all are discussing. Another was looking at the healthcare infrastructure. That is really around how do we coordinate services across the state, looking at what services are available here, what services are going across our state borders, looking at the different opportunities for funding structures, really looking at that wide variety of the system of healthcare delivery. The third was on primary care, really focusing in on how do we ensure that Wyoming has a strong primary care network and what does primary care mean in Wyoming? So that group was then, the last group was the social determinants of health. As we all know, health is determined by many factors that we really need to ensure that we are looking at, as well as just our actual healthcare service providers. So that's looking at things like housing, transportation, all of the different things that people need in order to access healthcare. So around March of this year, the 4 subcommittees put forward some ideas to the larger task force group and then to the governor for consideration to really break down those ideas further. As you all are aware, healthcare is very complex. There's lots of great ideas about how we can potentially tackle some of these issues. However, we put together then a working group to make sense of all of the recommendations out of the 4 subgroups, because there was a lot of information and we need to make sure that we're really intentional about how we take those different ideas and put them into some sort of framework so that we can start to prioritize what's important to the state. And then once we achieve that, then how do we start to look at implementation of different strategies to accomplish some of those goals? So the working group has met several times. It's a smaller group that is really meeting on a really regular basis to dive in and essentially establish a framework that we can, as I mentioned, start to work from. And that's the document that you all have in front of you today that we'll go over. Also, these ideas that came out of the 4 subcommittees, as I mentioned before, just really rough in nature. And so we want to be sure that as we look at that, that those ideas are something that's even possible in our state. And so again, that's why it's really important for this working group to take that stuff and consider really how to break that down more intentionally. The benefit that we've had of this effort up to this point is that we have all of the parties who are decision makers in that healthcare policy area and funding at the table to be part of the solutions. We have the large group that is meeting on a monthly basis of kind of updating, making sure that there's continued ideas with a platform to be able to bring those forward. But then the smaller working group also was very intentional to make sure that we have the right people at the table who can make those decisions as we start to put ideas together. Additionally, one of the things the governor has talked about is he really does want to ensure, as we get this plan more in place, of how do we get public comment about what's important to the public. We have put together some of the potential values that we see in Wyoming as healthcare priorities, but how do we get the public bought in and understanding the work that we're trying to do of really making us a system that's robust for all of our citizens. So what I will do now is I'll walk you through the strategy map that you all have in front of you. I just want to be very clear, this is a working document. It's just a draft. This group is starting to narrow down how we put all of the stuff into a specific framework, but this will change and evolve as the work goes forward. So just know that what you have in front of you will definitely be changing as we continue our work. So as you look at the strategy map, the group has come up with a vision of what they would like to see is that Wyoming would have healthy and thriving communities across generations. We really want to be focusing not only on what now are our issues in healthcare, but what are the issues that we need to be very mindful of for the next generations to come in Wyoming. Through the strategy map, you'll see here our core purpose is really focusing on 3 areas that we have narrowed it down to. One is managing costs. When we talk about managing costs, that doesn't always necessarily mean cheaper. What that means is that we have to be able to look at those things comprehensively. In some areas, it might mean cheaper. In some areas, it might mean that we are looking at how do we distribute the funds in a different way. Or in healthcare, we see a lot of cost shifting. And so we need to be mindful of that as we're looking at managing costs. Additionally, then we have access to affordable primary care for all of our residents. We know that primary care is the building block of our healthcare system. So how do we ensure that we have available primary care across the state of Wyoming that individuals can access? And we know there's a wide range of what that can look like. And then thirdly, how do we provide quality care throughout that continuum of services? So how do we ensure that we have quality primary care, specialty care, all of those different things as we look across the whole healthcare continuum? That then led us into our strategic objectives. So as you see here, the first one is establishing a comprehensive healthcare delivery system where we are focusing on essential services and primary care. So what we mean by essential services, that was defined in the hospital report that was completed a couple of years ago, that really looks at ensuring that we have trauma services, that we have cardiac services, that we have stroke services, all of those things that we would consider as essential that people need to have readily available to them. And then also primary care. When we start talking about specialty care, that is where we know that people have options and shop for those services. And so what we really wanted to initially focus on is making sure that we're looking at that essential and primary care. The second is reimagining and establishing a healthcare funding structure. So that really starts to look at how do we define that? In our state, what is it that makes that sustainable? And how do we look at that through our current demographics in the state and some of our projected demographics? And additionally, what is the role of the government in that? And so that is another part that is really important as we look at the overall structure for Wyoming that we'll be considering. The third is building capacity to ensure availability of coordinated resources and having a network for that across the state. As many of you know and have heard year after year, lots of the needs assessments that are completed, many of our Wyoming residents don't know what resources are available in their community and how to access them. So really figuring out how do we bridge that gap and ensure that we have available resources. What are the services that might be missing and how do we ensure that people get connected to those? Sometimes it might not be an issue that the resource isn't available. It just might be that people aren't aware of it. So really ensuring how do we do that collectively in a coordinated way across the state? Fourthly is to establish and strengthen strategic communication and education to consumer providers and partners. Additionally, this is not anything new that you all have heard before, but many individuals are not aware of what health care is in Wyoming, really don't understand the system, how to access the system, what the system means to them. When you start talking about health insurance, that adds another complexity to it that many individuals don't understand. So how can we really ensure that Wyoming residents understand what healthcare is, how to access it, how to maneuver the system, really just ensuring that individuals are smart consumers of healthcare in Wyoming, regardless of how they receive it. And also doing that for providers. Not all providers know what resources are available to them. Also helping providers to understand the changes that are continually happening in the healthcare market. So that is something that we really want to ensure that we all can hopefully be on the same level playing field when we have these discussions and talking and using the same terminology. And lastly is to expand and strengthen healthcare workforce capacity. You all just heard from Workforce Services. We know that we have a lot of challenges in Wyoming around our workforce. Again, not a new topic for this committee, but something that's very important. We know that we have a difficult time getting providers into the state in a variety of professions. And so how do we really work at strengthening the workforce that we have so that they can meet the needs that we have? How do we assess where we actually have gaps in providers? And how do we utilize providers to their maximum capacity? And making sure that they have the opportunity to be utilized in the profession that they are representing. So that is really an area that we feel is really important. We have some immediate needs around that workforce capacity, but also looking at that into the future, because we know that we need to be building programming that is not only sustainable, but flexible enough that it can change with the growing needs of Wyoming as our needs change. So that is really a quick snapshot of the work that the team has been doing. The team will meet again on June 30th to continue to prioritize and look at the ideas that were brought forward, fit them into this framework. At that point, then specific tasks will go back to subcommittees for them to work and detail out some more of those plannings by looking at the data, looking at our demographic information, looking at our referral patterns in Wyoming, and figuring out how we then take those ideas and put it into some sort of meaningful priorities to move forward. As you all know, healthcare, again, is complicated. The governor intends for this group to be together probably for the next several years to do this work. It's not something that we want to rush through because we want it to be intentional, but also ensuring that we're looking to the future with that as well. So with that, Madam Chairwoman, I would stand for any questions regarding the work of the task force.
I may actually have you just go ahead and present on the governor's ARP dollars priorities too, because I suspect that there might be a little bit of overlap as far as people's questions. You know, the governor's office may have thought of using funds to address some of the thoughts. And so rather than have us layer those on, let's just go ahead and then we'll ask questions at the end of your presentation about all of that.
Sounds great. So as you all are aware, the governor has put together what is being referred to as the strike team. The strike team is a group that has municipality representation, county commissioner, legislative members, state agency members, and the governor's office, a couple of team members from there, to really look at what are the needs of Wyoming. How do we utilize this one-time funding opportunity? Again, I guess I like that word today, intentional, in a very intentional way so that we put this funding to good use for future generations, making sure that it really has a comprehensive look at multiple areas. So part of the strike team then has been divided into groups. One is focused on health and human services, which Director Schmidt from Department of Family Services is coordinating. There's one that's looking at business and economic development, which Josh Durrell from the Wyoming Business Council is heading. And then the third one is education and workforce, which Director Cooley from Workforce Services is heading. And then additionally, Interim Director Johansson is also working on COVID response. So making sure that we're looking at the immediate needs that may still remain from COVID and what we need to continue to address COVID in the future. And then the three other teams that are looking kind of more at some of those big picture things and looking to the future. So those groups have put out a survey that asked for input through state agencies, that also looked at stakeholders across Wyoming, had an opportunity to put their ideas and information into a survey that now that strike team is taking and looking at all of those recommendations and starting to look at how they prioritize those in those three areas. As you can imagine, there was a lot of ideas that came forward, a lot of overlap in those ideas. And so I think they're sifting through that to figure out really how to make sense of all of that information at this point. The healthcare task force recommendations that will come forward will also be embedded into the ARPA discussion as those become a little bit more concrete. Again, they're not mapped out entirely perfect yet as to what some of those would be, what it would entail, and even if they're a priority that we would want to move. But that certainly is an opportunity for us to look at how we could move some of the things that we have in our healthcare system. And when we talk about healthcare, we're also talking about mental health. So just making sure that that's well understood, that in the health task force, it's not just about going to the doctor for your physical health, but it's also looking at mental health as well. The strike team is looking at 3 phases. The first is the survive phase, which they are looking at having those recommendations based off of immediate needs that we have right now that we need to look at funding immediately. The second is the drive phase. The drive phase is really looking at what barriers or issues do we have in the state that were caused by COVID or maybe even just exacerbated by COVID. And what are those specific issues? And then the thrive phase is the last phase that really looks at the long term and setting us up for success of then how do we implement ideas based off of the barriers and issues that have been identified. How can we then take the ideas that came forward and utilize the ARPA funding to make long-lasting change in Wyoming? So that is work that team is engaging on now, and they will continue to work through that as, again, they put all of those ideas and recommendations forward. I know that now that we're not having special session, those discussions will continue to evolve and making sure that there's adequate input on how to do that and do that well. So now I would be happy to stand for any questions that you all might have on ARPA or on the task force.
Questions for Ms. Davis? Representative Hallinan.
Thank you, Madam Chairman. One of the issues that was brought up in the treasurer's report that we received a comprehensive list of, one of those issues that was brought up was addressing the problems with water and sewer. But I didn't hear you discussing that at all in that strike force. Is the strike force going to be addressing those issues as well?
Ms. Davis, and I will just say that I'll let her answer the question, but it's probably not that closely related to the Labor Committee topics. Go ahead, Ms. Davis.
Madam Chairwoman and Representative Hallinan. As you all are probably aware, there are multiple funding structures that are coming out to the state. One of the discussions is looking at infrastructure for the state, and water is part of that discussion, the water infrastructure and how that how we look at that for the future of Wyoming. And so that is definitely part of the discussion at our office. I don't know, to be honest, if that fits in with the ARPA or if that fits into other funding structures that are being offered through the federal government, but that certainly is one topic that is really priority on the list.
I saw another hand, Representative Connolly.
Thank you, Madam Chairman. And Ms. Davis, I'm curious about how the task force or the strike team are thinking about kind of standing up kind of newer programs with ARPA funding. You know, there's a little bit of a respite with us not going into special session, but it's 6 months down the road. And in particular for kind of visionary programs that we haven't had money for in the past. And so we know that we have an absolute need to address prevention. And again, prevention is really difficult when there's immediate needs, but that's a visionary program. So prevention, mental health, suicide prevention, addiction treatment, all of those kinds of things that are, I think, appropriate for this committee to be taking a look at. But when are we going to hear about some of those initiatives and how are they going to be vetted?
Ms. Davis.
Madam Chair, Representative Connolly, that's a great question. And something that the task force has definitely on our radar is that we need to look at innovations. And the ARPA funding does give us that opportunity that we haven't had in the past for funding. So those recommendations went through the survey that I mentioned. And again, not just from the task force, but from public stakeholders from a variety of different areas. That strike team is going through some of that information, and then that will be vetted through the strike team and prioritized, because again, it's a lot of money, but when we're talking about standing up new programs and utilizing funding that is one time, part of the vetting process will be looking at where do we have sustainability for those fundings, for those programs, with funding after the ARPA funds go away. So it is definitely something that is part of the discussion and something that, as we all know, has some urgency behind it because the ARPA funds also have a timeline. And so when we think about the innovations, we're also thinking about how do we look at being real intentional in those conversations of, do we have the means to sustain that later? Or is that innovation something that maybe should take the place of something else that maybe hasn't been working as well in the past? Mental health and substance abuse, it is a great opportunity for us to look at innovations. Suicide is a huge area. The governor also has recently engaged in the Governor's Challenge, which is a multi-state opportunity through SAMHSA and the Veterans Administration about looking at suicide prevention for veterans, active duty service members and their families. And that effort really is overlapping with Health Task Force recommendations as well as ARPA recommendations. So that team the strike team is working on getting the recommendations in front of the governor. And then I know the governor, as you all saw in the letter, is working very closely with legislative leadership to then determine how things get prioritized. And I wish I could give you more details on that, but I just don't know because I think they're trying to work it as fast as they can with all of the information that's come in. But it's certainly something they are looking at and prioritizing how to use that effectively.
Chairman, yeah, follow up. And Ms. Davis, I would just ask that we get that information hopefully at the next meeting, if it could be back on the agenda, but also for the committee to take into account that when doing that cost benefit analysis and what it means to stand up a program, that often these programs pay for themselves down the line. And that's something to really take into account, that a prevention program today will save us with emergency room visits 4 years from now, for example, and to really try to do that kind of arithmetic as we go forward, because to me, this is an opportunity that we have that we didn't last year, for example, but we have to think a little bit differently about what it means to stand up those programs. So just my 2 cents, and I would really like to hear more about it.
Representative Stiver, did you have a question?
Thank you, Madam Chairman. I'd like to get a list of the whole team, that team you're talking about. You mentioned the directors of each one, but I want a list of all of them, because what I'm concerned of is about the main effort with all this money that's coming out. We start setting these things up in the main effort to keep them going down the future. That's got to be discussed and looked at before these things get stood up.
Chairman Wilson, Representative Stivar, I just want to make sure that I understand you correctly. You would like a list of the strike team participants? Okay, we can do that for you.
Representative Ottman.
Thank you, Madam Chairman. I just want, this is kind of a point of reference, but I just want to see if you're aware of it, because we've been talking a lot today about collaboration and getting people to work together to be more effective. And so here in this county, and that's why this is where I live, so I know about this. There is a movement for a private or community hospital, and it's going. So there's things about some of the funding and applications that they couldn't get and this and that. But are you aware of that? Because there's also like a Billings affiliate, and they're doing a lot of rural healthcare. So is your task force aware of this movement so that they can consider what these folks are already doing and or maybe looking at their expertise or anything like that? Thank you.
Madam Chairwoman, Representative Ottman, yes, we are aware of the discussion that's happening in Fremont County around the establishment of potentially a new hospital. There has been lots of discussion in the task force about how we look at infrastructure in Wyoming, which hospitals are obviously a big part of our infrastructure, and what that means for individuals having access to services. So that is definitely a part of the discussion as we start to look at how do we consider what infrastructure should look like in Wyoming, and where do we want to make sure that those essential services I mentioned, as well as primary care, is at, and then what does specialty care look like? And so hospitals have been having lots of discussions over the years about what that can potentially look like. I know the issue that's happening in Fremont County, our office is very well aware of. Again, a local issue that you all are dealing with here about how that interfaces with your current healthcare system. But it certainly is something that we are keeping an eye on about how that evolves. And then how do we make sure that as we talk about infrastructure building, that we have that network and system across the state that works well for everybody, including Fremont County, which also has more complexities than many of our other counties.
Madam Chairman, thank you. So are you kind of insisting that this will all be regulated by what this task force deems as important?
Madam Chairwoman, Representative Ottman, no, not necessarily, because these are local issues. I mean, we don't have a program in Wyoming that regulates that, you know, when hospitals can be built or not. So that is definitely a local issue that you all are working through here in Fremont County. What we're looking at in the task force is really from the perspective of ensuring that we have adequate infrastructure in the state. So do individuals who live, you know, in Hudson have access to those essential services in primary care? Do individuals who live in, you know, Lingle, Wyoming have access to those services. So we're really more focused on what does the overall state infrastructure look like? And then as we look at that, are there things that we need to do to ensure that we get that access? But also we have to keep in mind, which is the complexities of it, is those things come at a cost. And so when you look at that, and when we have multiple services in one area, how does that look when you start dividing a small population across multiple payers? And so again, it's taking all of that into consideration. And that again is why the governor will also be seeking public input into this, as well as the task force, to see, you know, where does the public prioritize that? Because it gets very complicated when we start talking about a state that is very large geographically and that lacks a lot of that infrastructure. And that again comes at a cost. So we're going to have to prioritize what that looks like in the state as we move forward.
Okay, and just on behalf of all the people that are working so diligently to do that over the last 3 years, they are looking at the cost and what services are provided in rural areas that where we live, and not necessarily cities. So thank you very much.
More questions for Ms. Dave? Chairman Baldwin?
Thank you, Madam Chairman. Not so much a question. I just wanted to address something Representative Conley mentioned. And that is to keep in mind, along with the task force, there's another parallel process going on with mental health and substance abuse at the same time. And then Department of Health can discuss that as well when they come to their part. But Representative Larson and I chair a committee. It's a select committee on mental health and substance abuse. We're percolating now. We're just starting to form things. We haven't had a meeting yet. We're waiting for some other things to happen. But one of the things that will be addressed is some of those preventative services, specifically Senate Enrolled Act 56 that we just passed this last year. We'll be addressing that. So there will be some more ideas coming out of that, which will work in parallel with the task force. I just wanted to make sure she was aware of that. And wouldn't you agree?
We all agree. Thank you, Chairman Baldwin. Senator Furphy.
Thank you, Madam Chair. Let me ask about, when you pointed out about comprehensive health care delivery and all the specialties that you're trying to attract to our state. One of the things that my community faces and many other communities in our state, we have competition from out of state, bigger population areas. So that's going to be a problem going forward, trying to attract these specialties with our limited population. So I hope the task force is considering that problem and that issue long-term, because we've seen that happen. We've attracted specialists and all of a sudden they're one individual trying to handle everything, and all of a sudden they're competing with out-of-state organizations that have 5 or 6 specialties, and so it's a real problem. So I hope the task force is considering that, because we have so many areas of the state that face that competition. Thank you.
Madam Chairwoman, Senator Furphy, we are absolutely looking at that. That is a huge conversation and goes kind of back to a comment that I made to Representative Ottman is, you know, we do have a small population and you have to have patience in order to maintain your service line. So how do we look at that really intentionally? Sometimes that cost is just simply more in Wyoming because we do have a lower volume. And then you have competing interests that can have larger volumes that then also changes the price point. So it's a huge conversation. It's very complex and very difficult, which is why this group will go on for probably several years, because there are so many complexities that we need to consider as we look at that. But that most definitely is on the radar. It's a big issue for Wyoming.
Okay, and Representative Senator Furphy. Sorry, I trained him up on representative. I keep forgetting to rephrase him.
Thank you, Madam Chair. Separate issue. Don't forget funding for broadband, my area of very much interest. So thank you.
Okay, let's stay focused on the Labor Committee topic here. That does kind of fit with telehealth. Representative Hallinan.
Thank you, Madam Chairman. My question has to do with possibly some type of following up on the question of Senator Furphy. Some type of a negotiation between some of these super specialists and the lesser specialized people we have in our state to work out some kind of agreement that we would use them and they would use us. They would send their patients back to the primary care people in our state. I think that would be a helpful resolution if we can do that. But that makes us, we'd have to have some really good negotiation with these other entities outside of our state. Thank you, Madam Chairman.
Any other questions? Okay, thank you very much for coming all the way up.
Thank you, committee.
Okay. Chairman Baldwin, if you agree, I think that we should go ahead with the 10:15 item so that people who are expecting it to happen before lunch will at least hear that. I'm going to turn the gavel over to Chairman Baldwin so that I can present the information on the bill draft. And I do want to just make a reminder before, in case Senator Baldwin forgets, before you go off to lunch, you will remember, those of you who signed up for the tour of the Life Resource Center this afternoon, that they stated that owing to federal regulations because of their type of facility, that we are to wear masks. So if you haven't got one and you're going to go on the tour, make sure to find yourself one before the end of the day.
Thank you very much, Chairman Wilson. With that in mind, committee, we're going to be discussing this bill draft by Chairman Wilson. If you don't have it in front of you, there's one out there. It's online as well. Bill draft. Name of the bill is Vaccine Requirements Limitations, sponsored by Representative Wilson, draft 0.3. Chairman Wilson, would you care to present that?
Mr. Chairman, I was just going to sit over here so everybody could see me. Now, it does say sponsored by me at the moment, but obviously this was the concept of what we might call a vaccine passport type issue was on our request to the Management Council in April, and they approved it as our topic. So that's why it's here. So I put some ideas together and worked with LSO. And I'm just going to give you, now you did receive 2 white papers from LSO. I'm going to touch briefly on them, and they are available here to answer questions as far as those issues. I wanted first the goals of developing the bill, and you may have all heard from various constituents, people whether nationally or locally, concerned about the issue of a vaccine passport. So my goals in putting together the bill, as I did research, were first to balance the rights of individuals with, at the same time, property rights of business owners, conscious rights and professional judgment of healthcare providers, and balance all of those, because I think it's important to keep those all in mind. Some of the executive orders or bills we've seen nationally are really kind of one-sided and don't take the rights of business owners into account. So I wanted to balance those. Second, I wanted to have something that applies to all vaccines. I think it's important when we draft legislation to not just have a legislation that applies to, a particular 6-month period of life. But if it's going to be in the Green Book, it should be relevant to things more broadly. There are a lot of vaccines that people get: polio, measles, hepatitis. I know in Latin America, a lot of people get tuberculosis vaccines, which we don't typically get here, but I mean, that could come up if you had a lot of people come in from an area where that was a big problem. So that was something that I wanted to make sure that I would read through something in my head and say, okay, now, would that apply? You know, would a person expect that if they asked about your polio vaccine or something? So I wanted to make sure that that balanced out. And the final thing is I wanted to use existing legal concepts. We have in law now concepts of reasonable accommodation from the ADA, from labor standards, Civil Rights Act, that sort of thing. I didn't want to go creating something that created I mean, I'm not an attorney anyway, but I didn't want to create new legal concepts for a particular issue. I mean, I think it's much better to work within the body of legal decisions that we already have. So let me just go through, obviously, the first paragraph is the usual sort of thing that we see. So we'll pick up on page 2. And before we get, I asked Mr. Brody to put the staff comment kind of up front so that we could see this as we go through. And looking at Mr. Brody's memorandum, and I'm not quite sure where it is in your packet, but two things specifically. He, on the second page of his white paper, he discusses the legal concept of reasonable accommodation. I'm just gonna, so that you don't have to fluff your way to that, I'm gonna cover that really quickly. For example, under disabilities, reasonable accommodations are job restructuring, modifying work schedules, reassignment to a vacant position, modifying equipments, not obviously this having to do with disabilities. And it says, and then undue hardship is defined under the ADA as something that requires significant difficulty or expense when considered in light of factors such as an employer's size, financial resources, and the nature of its operation. And then on page 3 at the top of the page, dealing with Title VII, employers are required to reasonably accommodate employees, and this is specific to religious beliefs unless the accommodation would create an undue hardship. And I remember one particular legal case, it's been some years back, but I remember there was a case where some Muslim employees didn't want to, they worked for a trucking company and they didn't want to deliver beer and they were required to reschedule them. So there's a substantial body of law on those phrases. So I really, when I put this together, and obviously I'm open to input, although obviously I do hope that we end up sponsoring the bill. And I will just insert there, we put this on this particular meeting schedule in the thought that we were maybe going to have a special session, and it seemed like it would be timely to have the bill ready for that consideration if they were to bring in committee bills. Now we see that that's probably not going to be the case, but I personally, I think, and this is just, you know, the committee rules on this, but that it would be better to actually take action in case we do end up with a special session in September. Or, I mean, the leadership did seem to leave that open. I know, and Mr. Brody might have to speak to this later because as I say, I'm not an attorney, but I did speak with another legislator, not someone from this committee, who said, well, is this really a Wyoming problem? And I will grant you that I have not really heard problems about that in our state. I've seen news reports of situations like this in Utah and Colorado. I think there's a real advantage to the committee taking some action on this before it becomes a problem, because then you have businesses and people knowing generally what the expectation is. And also, I believe in the legislature, I don't know whether it's a law or legal case or what, but we're really not supposed to take action on things that are in the courts. So far better to act before it, and that's just my thought, and Mr. Brody can probably speak to that later. Okay, sorry to ramble on. So the bottom of page 2, the first thing here, and this is under the public health statutes, line 33, a healthcare facility should provide a reasonable accommodation to any person seeking to visit a patient or a resident. Okay, so this is just, remember, we're not dealing at all anything to do with masks. This is only about proof of immunization for whatever it is. I felt that people should be able to, you know, visit their loved one, and again, reasonable accommodation. And I won't go into that much depth on all of these things, but I don't think we can reasonably in statute pin down exactly what accommodation should be for every kind of healthcare facility, because in my mind, there's a big difference between your desire to visit your father in hospice who's got 3 weeks to visit to live versus maybe your child is having his tonsils out and you've got 7 relatives visiting from out of town. Do they really need to all be there in the tonsil patient's room? Maybe they could call in by Skype. So, I mean, I just say, I think that that's where people do reasonable decisions on things. Top of page 3, a governmental entity or public employee shall provide reasonable accommodation to any person seeking to access a publicly funded service. This is really the essence of the governor's executive order, but of course, the executive order only can cover the state things and not others. Then you'll see the definitions. What is a government entity? And those government entities in the existing in statute are cities, towns, counties, school district, joint power boards, public corporations, community college districts, political subdivisions, the state, the university. That's what that is. Healthcare facility, again, those are definitions are existing in statute: ambulatory surgical center, assisted living, adult daycare, birthing centers, diagnostic testing centers, hospice, hospitals, nursing homes. I mean, there's a longer list, which I can go into if you want me to, but bottom of page 3, and this is where Mr. Brody was quite helpful, of course, bringing in the legalese. What is a reasonable accommodation? Change in policy, process, location. So line top of page 4, line 3, unless it would create undue hardship, and that's again in existing law. Okay, page 4, line 14. This is essentially the Wyoming version of the civil rights, the Federal Civil Rights Act. Existing, we have existing law on equal enjoyment of public accommodations. You'll see that's existing there. And this is where I don't know if I want to call it creative, but this is where I attempted to address kind of the conflict between people saying, well, I want to be able to access whatever service without providing, some sort of immunization passport that we've seen in other states. But at the same time, we have an issue where business owners have a right, I feel, to essentially run their business as they see fit. So what I did here was on line 17, I said, any provider of an essential service or product shall provide a reasonable accommodation to any person. And then top of page 5, I define essential service or product. And the way I did that was when the CDC released information on the tiers of people to get vaccinated, the COVID vaccination, they listed out by NAICS codes, which we heard about earlier this morning, what are essential services. Well, not all of them were relevant to this. I mean, for example, they had energy workers. I mean, I don't feel like that's an issue here. What I was trying to aim at is, in life, what are things that are so important that a person really has an expectation of being able to access them? I don't want to go necessarily into moral rights, but so that's where I pulled out from the NAICS list at the CDC. And you can see there, pharmacy, drugstore, physician, physician assistant, nurse practitioner, dentist, physical therapist. And the reason I was thinking that is if you were discharged from a hospital, say after having hip surgery, you really ought to be able to see your physical therapist. Mental health specialist, dialysis, ambulance, hospital, funeral home, grocery stores, crisis shelter, bank or credit union, special needs, transportation, or gasoline station. Then we have reasonable accommodation, which is what we talked about before. So here's my thinking on this. And I'm kind of backing away from this again. I feel that a person ought to be able to buy groceries. What would be a reasonable accommodation? Pretty much what grocery stores came up with over the whole last year, right? You can call in your list and they'll come out to your car in the parking lot with a bag. Okay, I think that's a reasonable accommodation. On the other hand, I don't personally think, maybe someone will call in, I don't think you have a moral right to have a tattoo. So if, that's just me, if a tattoo parlor wanted to say, we're not tattooing anybody unless you can show proof of your vaccination, well, I think that's a bad decision in Wyoming because I think you'll run out of customers within about a month, but that's the business owner's right. And I don't feel like I have to make them make an accommodation to figure out how to tattoo me, or even bookstores or something. So that's how I set up that paragraph, what I was aiming at. Again, try to find the right between what a business needs to do, how can they accommodate people who need their services, and what services do we need. The bottom of page 5, this line about the penalty, that's existing statute. The only thing that's done there is to change paragraph B to C. That I didn't touch that. The next part is about immunizations in schools. Page 6 is all existing language. We have an existing process for what immunizations need to be required to put your child in school. And I want to appreciate Representative Stivar, who gave me some heads up on some of the components of how that all works. So I've done the existing statute. If a child is not immunized, they are allowed to be in school. So we're talking polio, measles, the usual sort of stuff. But if there were, say, a polio outbreak, the unvaccinated children are sent home and they are schooled by distance learning or something. So I would perceive that this procedure would work the same way as the existing procedure if your children are not immunized. The only things I've changed in here is on the top of page 7, lines 3 and 4, I inserted, and this would affect everything, a personal objection to administration of any vaccine. Right now, all we have is religious objection, and LSO can talk further to that. The law is really quite liberal on that. A person who claims a religious exemption to having a polio vaccine, say, is not required to show some sort of religious documentation that polio vaccines are prohibited by their scripture or anything like that. You basically say you have a religious exemption, and that's by court decision, that's all there is. I felt like that gets pretty far to the concept of personal objection anyway. If you can't really detail, show me why should it be that? I mean, maybe your personal objection is, I don't know what, you're a vegan and you don't want vaccines grown in chicken eggs, or I don't know what it might be, but so I just put that in. Then down at the bottom of page 7, and I admit I kind of shot from the hip on this, but this is a little bit specific to COVID. I put in a paragraph, and this again would apply to anything, future vaccinations, whatever, that an immunization shall only be mandated after a 5-year period. So I'm going to kind of summarize this. Once the FDA and the CDC have approved any vaccine for use. So let me just explain how vaccine approvals work in general, or medications. When a pharmaceutical company begins developing a vaccination, as they develop it, then there's a phase 1 clinical trial, which is lasts a few months just for safety. Make sure whatever you've come up with is not going to kill the person. Then there's a phase, and that has not that many people, maybe 50 or somewhere around there. Then phase 2 is for effectiveness. Normally that lasts several months to 2 years, and that'll have some more people. Phase 3 is often several years long, and they will do safety and effectiveness testing on more people, several thousand, usually about 3,000 people on that. After phase 3 is completed, the FDA will review the medication or vaccination and grant it a license. Okay, so where we are with the COVID vaccine, just circling on that, is that it has been granted emergency use authorization, which is what you do when you've not completed all of the way through phase 3. After the FDA reviews the license, then there's the ACIP, which I wrote down somewhere what it stands for, Advisory Committee on Immunization Practices. They review these things and determine whether the vaccine, once it's been approved as effective and safe, whether it ought to be part of the approved schedule of vaccines for pediatric use or whatever it might be. How often, should you get your tetanus shot every 10 years or whatever it is. And then after that, there is a post-approval monitoring period where they monitor for safety. So I will be totally honest on this. I just made up 5 years. I just made it up. But my feeling was that the time in Wyoming in which we mandate that people need to vaccinate their children for school, there should be a time at which you have had sufficient time to see what the side effects that have been reported. Because many side effects of things wouldn't show up, I don't think, after 2 months. And I'm not a clinician, fair enough. But that's, as I say, and fortunately, we have at least one clinician here who can speak to that if he wishes. But I just picked 5 years. I will admit I had no specific basis for that. I just made up 5 years. Okay, page 8 goes to employment practices. The Federal Department of Labor has issued in the spring a statement that it is not an unfair labor practice to mandate vaccination for employment. And we have seen nationally where there are situations where employees are faced with either losing their job or being vaccinated when they didn't wish to. That was a ruling of Department of Labor. In the states, we can give people more rights than the Fed decides, but we can't really give them less. Okay, so for example, in civil rights law in general, the Civil Rights Act at the federal level impacts businesses with 15 or more employees. In Wyoming, our law says 2. Okay, so that's a choice that we can make in the state. We couldn't say it only impacts people with 30 because the feds have sovereignty over that and they said 15. But we can be more gracious, shall we call it. And so that's what I'm doing here is I'm putting vaccination documentation in here as an unfair employment practice, looking at line 14, that the people can use reasonable accommodation. So in other words, if you say, I don't want something or other, whatever, polio or something, if they can accommodate you by putting you in a different office or whatever, then that's what is expected of employees or employers. If you have a 2-person shop and you have to, I don't know what, be outside all the time and your vaccine requires you to be inside, obviously that's not, I'm making something up, but that's not reasonable. And added, page 9, added the word personal on line 10. So I kind of breezed over it. I'd be glad to answer questions, and the LSO attorneys who drafted the wonderful white papers, for which I thank them, are there also. Mr. Chairman.
Thank you, Chairman Wilson. Questions, committee? Representative Stivar.
Thank you, Mr. Chairman. The question I have, 1947, the Nuremberg Code. How does that correlate to the Nuremberg Code from 1947? Because there's lawsuits out there right now, international is going on. There's some in Texas. How is this going to affect that? Or what will it?
Mr. Chairman.
Chairman Wilson.
So I have not specifically quoted that, but I'm somewhat familiar. My understanding is that prohibits people from basically being experimented upon, is my understanding. So part of the FDA's regulation for emergency use is that so this is speaking specifically to the COVID vaccines or others that have been authorized under emergency use. That's a legal discussion that I'm not capable of saying how that would come out. The only thing I can say is that in this bill as drafted, where you can't mandate without making a reasonable accommodation. I mean, I suppose that there might be some other lawsuit that would say you can't mandate anything that is still issued under emergency use. I mean, that's already federal law. So I don't think that this bill goes beyond that. There may be, I'm not sure which, if either of you, probably one of you had that maybe touch, not specific to Nuremberg, but do you have anything that you want to add to that?
Go ahead, Josh.
Mr. Chairman, as part of the research into the 2 federal Title VII and Title I of the ADA, Nuremberg did not come up in my research. So we can certainly, LSO is always prepared to provide more research materials to the committee if it would like.
We appreciate that. Further questions, committee? Representative Stivar has one finger up, but I'm not sure if that means a question. Go ahead, Representative Stivar. Okay, any questions? Representative Halloran.
Is it time to make any comments about this bill, Mr. Chairman, or is this just for questions?
Let's do the questions now. We'll get
Okay.
to a comment period here in a minute. Go ahead, Senator Bouchard.
Thank you, Mr. Chairman. I had constituents that worked for the state. And there were various memos going back and forth that it would become a mandate. Some of it was in corrections, state correctional office or officers. And so I had a bill that said that, you couldn't force that mandate. And I really believe that if we're going to do something that's going to affect private sector, we should be doing it firmly in the government first, because that's where the heart of how freedom moves out. It moves that the government should be there first, making that action. So I just don't, do you have any thoughts on how to do that in this bill?
Chairman Wilson.
Thank you, Mr. Chairman. So Governor Gordon has issued his executive order prohibiting that for the state government. So that took place, I think maybe a month ago. So with the top of page 3, where it says that the government has to provide reasonable accommodation for, I guess if the question would be to make it even firmer by saying that they don't have to provide reasonable, I'm not sure legally how that, I'd have to leave that to the lawyers on whether that would fit in, but for the time being, certainly the governor's executive order, I think, fits what you're saying.
Follow up. Go ahead, Senator Bouchard.
So my concern is, Mr. Chairman, my concern is that we've seen these studies now that say that people that had COVID and people that have the immunization, because you heard about the need for booster shots and everything, but now that it looks like there's some continuity between people that had COVID and people that are getting shots. So the reasonable accommodation would mean, well, we can still mandate, but we can do something else for you. So I'm just coming back to this where there's so much we don't know, and we jump out there and we start, let's just say in the health care field, where they were within the prison system, within corrections, they could tell certain people inside the prison that they must be vaccinated. And so that's where I'm having a problem. I think we have to be a little more firm here and put it into statute and not be in the courts at a later date.
Chairman Wilson.
Thank you, Mr. Chairman. So there is existing law that enables employers to request to require vaccinations. And I don't know all the case law on that, but I'm thinking of like hepatitis C vaccinations for healthcare workers and that kind of thing. I feel like to walk the line between the rights of an employer to run their business as they see fit and the right of an employee to live their life as they see fit. I do think that we need to take both into consideration, because the thing is that the legal decisions that we make in this can end up being applied elsewhere. And so if we're going to say that an employer now cannot mandate that an employee wears shoes to work or something, what I'm saying is that I think I felt that this is a legal place that is accepted now. And if you carry it out of balance, sometimes a year or two later, you find yourself in a place that you didn't mean to be with employers and employees. So that's why I was walking this route.
Go ahead, Senator or Representative Ottman. You can be a senator if you want today. Go ahead.
Okay. Thank you, Mr. Chairman. And I don't mean to muddy the waters, so if this is, but recently I've had the opportunity to do quite a bit of traveling. And one of the things that was very upfront was that be free if you get a vaccination. Okay. And the other thing is, oh, okay, if you don't have a vaccination, then you must wear a mask. So is this a place, would this be a place that we should cover that too? Or is that something totally different? Because I don't understand how that could be mandated, but it's really being pushed in a couple states. And so I'm just not sure about that because it's important, this whole issue. And I thank you for bringing it up.
Mr. Chairman, so this bill basically addresses the issue of sort of a passport of some sort, whether it's an app or being required to show proof of vaccination. I'm not going to attempt to go into what kind of signage people can post on their business window. I mean, that's beyond my scope, really, I think.
Senator Furphy.
Thank you, Mr. Chairman. What I'm wondering about is defining essential service, because I think of, for example, I would add to this plumbing, electricity, etc. I think those are essential services. So my question to you is, shall we not define essential service, leave it broad? Because there's probably other things I'm not thinking of that could be considered essential service. I just asked that question.
Chairman Wilson.
Mr. Chairman, thank you. Yes, the list could get really, really long. But what I'm trying to do here is, from the point of view of a business, so let's just say the plumber. Suppose there's some plumber in Wyoming. I find it very hard to imagine one, but suppose there's a plumber who says, I'm not going to go to your house to work on your water pipes unless you prove to me that you have been vaccinated. I mean, first, it's kind of hard to visualize. And if you don't want to show the plumber that you've been vaccinated, you could just call another plumber, really. I'm trying to find the line between people who run businesses can make choices, I think. I'm not going to mandate that plumber Joe has to go to someone's house that he doesn't want to provide a service to, unless I really feel like people may have very limited options and it's really necessary. So that's why I just tried to not make the list too large. And that way, whatever other businesses there are, that if they feel that they want to require proof of vaccination to go into whatever the restaurant or whatever, that's on them. And I'm really allowing businesses to have some freedom as well. And it's a hard conversation in Wyoming, where we take everybody's freedom seriously, and sometimes they clash.
Representative Orff.
Thank you, Mr. Chairman. I have a question. I see this sentence used throughout. And the easiest is to point to on the bottom of page 2, where you talk about if the person is unable or unwilling to provide sufficient proof of immunization. I question using the term sufficient proof. I don't see it defined here. And I think, to me, I don't like it. It's arbitrary, and I could see that being a problem in the bill. And I wondered if there was a reason the word sufficient was put in there rather than just saying provide proof. Because I would probably prefer to just strike sufficient and leave it to where it says if they're unable to provide proof of immunization, and drop the sufficient altogether. But that's a question I have for you.
I feel a potential amendment to a potential bill. Go ahead, Chairman Wilson.
Thank you, Mr. Chairman. Yeah, Representative Orff, to be honest, I don't remember writing the word sufficient when I drafted it, and it may just be a feature of, several versions of drafting. I agree with you. I think the word proof is Sufficient?
Clever.
I don't
clever.
have a problem with that
I
one.
see how you did that. That was good. Representative Conley.
Thank you, Mr. Chairman. And Madam Chairman, because I'm a little confused about some of the language that's being used about wanting to allow for businesses to make choices. Because I see this bill as very specifically not allowing businesses to make choices. And in fact, it makes it an unfair labor practice if a business would like to require vaccination. So I am confused about that language about choice, because to me, that doesn't seem to be the case at all right here. But then I'm also kind of confused about workers, right? So I understand that there's an attempt to balance the employer with an employee who does not want to be vaccinated. But what about those other workers who want to work in a safe environment? So I don't see those workers being accommodated in any way right here as well. And then I've got even a follow-up to that, which is then in, my community, we now have some businesses, coffee shop I like to go to, that has a now sign on the door that says, all workers have been vaccinated, masks optional, something like that. And what happens there? So a bunch of questions in there about my confusions.
Go ahead, Chairman Wilson.
Thank you. So let me just start with the signage. I'm not addressing signage here. I'm just gonna just not plunge into the signage as far as masks and such like. I mean, this bill doesn't really have anything to do with masks. I'm perfectly willing for, if I had to come in and put on my mask for half an hour, I don't feel like I'm gonna legislate that. So I'm not going there. Backing up, and hopefully by the time I get to the first one, I won't have forgotten what it was. As far as the other workers, I think that from my take, that works basically the way it is. If a person is concerned about vaccination status, they should be vaccinated. And so, I feel like the same thing happened. Does anyone in this room, is anyone concerned if somebody here has not been vaccinated for measles? Probably not, because you're vaccinated. If you're vaccinated for measles, you're good. So I think that is the purpose of a vaccination, is basically to protect yourself. The things that I'm vaccinated, again, I am not worried about. You go to, say, Southern California, I think something like 15% of the school children are not vaccinated against measles and such like. Hopefully if you're vaccinated, it shouldn't be your problem driving through Los Angeles. I don't know, but so that's my thought on the other employees, is that your own vaccination status is under your control, I think. Then backing up to the choice. So what I've tried to do here is, that's where I put in the reasonable accommodation. And I believe that is the choice. If you are a business, let's say selling groceries, and we've all seen this. I haven't used it myself, but if you're a business that is basically listed as essential, then I feel that you do have a certain responsibility to provide services to people, whether they've had their polio shot or their measles shot or whatever it is. But if you start to feel that there's too many unvaccinated people in this world, and I want to require vaccination, but if people don't want to show the documentation, they call in a list or call it on their computer, and I go out to their car and hand in there. I think that's a reasonable accommodation. Pretty much everybody that's doing a reasonable accommodation has probably addressed those. The business can still say, you can't come in without a vaccination. Okay, if I don't want to go into your store, then at least I can still buy my groceries. That's how I picked those. Things that I really would still need to access. If I, as a person, said, I refuse to show you my vaccine, it doesn't stop the business from requiring a vaccination. It's just saying that in those circumstances, you've got to make your service available to people because you are really important.
Follow up, go ahead.
Thank you, Mr. Chairman. Sorry, I don't think I was clear. I'm not talking about reasonable accommodation for the public, although that's another good point, thank you. But about it's an unfair labor practice now for an employer to require vaccination. So I'm not talking about reasonable accommodation. It's the unfair labor practice when it really isn't about a business making a choice. You are making it an unfair labor practice for a business to require its employees to be vaccinated, is at least my understanding of the bill.
Mr. Chairman, so the language that we've put in here, and again, I tried to have, use legal staff to rely upon existing statute. So from existing court decisions, as a condition of employment, so I'm on page 8, line 11 and 12, unless the employer can demonstrate that an unimmunized employee would create an undue hardship. So perhaps maybe you have several lupus patients who can't be immunized as well, or I mean, I don't know what, or pose a direct threat that cannot be eliminated or reduced by means of a reasonable accommodation. And again, I feel that and this is where, so let me differentiate between masks. Whether you like them or not, I feel like to, require a person to, like my daughter works at a place where they have to wear a mask all day long. Be really annoying to me, but that's her job and she wears the mask and okay, fine. I think that that's a level of difference to me with requiring that your employee put a certain chemical in their body that they don't want, and that their choice then is to do that or lose their job. I feel like that's a whole different level of difference than saying, well, you got to wear your mask all day, or you can only wear red and white clothes, or some other thing that's maybe annoys you, but it's not really the end of the world. And so we have reasonable accommodations in labor law already. What's a reasonable accommodation for a pregnant woman? What's a reasonable accommodation for a Muslim person who doesn't want to deliver beer and you're a trucking company? Some of those are maybe a little bit inconvenient, and it doesn't say that you can, again, and maybe Mr. Brody needs to come in on this, but that's where I tried to take existing case law about what's reasonable and what is undue hardship, what is more than de minimis expenses and that kind of thing. I mean, that is the best that I can do, because I think you're right. There are balances here between what can an employer require, how can an employee go to work and not have some mandate on them? When does an employee just have to say, well, then I quit? It's hard to find a place where everything comes out exactly even. I admit, and that this is where I wrote it.
Senator Hutchings.
Thank you, Mr. Chairman. Madam Chair, I really like what you've put together here. I think you did a brilliant job. I don't like the page 7, Romanet 4. I'd like to see that removed, because it's kind of conflicting, and just in my mind, we're trying to get away from a mandate, and then here we're saying, okay, after 5 years, whatever, we're going to mandate it. But just to see if you agree with this, there's a famous slogan out there, and we hear it all the time: my body, my choice. Do you agree that this is kind of where you're going with this?
Chairman Wilson.
So let me address the paragraph first. So we currently mandate certain types of vaccinations to attend public school. That's where this is, in the public school and daycare statutes. I am not attempting to change that, but we have also a current workaround for families who choose not to vaccinate their child, that they can actually attend public school, but if there's an outbreak for that child's health, they're sent home. They don't worry about the children who are still at school because they've been vaccinated against polio and measles. So the is that a word? Mandation? The mandate of the immunization is only falling under existing mandates of vaccinations for school. And it just actually adds a tempering to when they can be mandated. And as I say, I kind of made that up. Now, as far as the My Body, My Choice line, and I hazard, it's a hazard to even go there probably. I will say public health is one of the oldest functions of government in the world. It dates back to the Roman times, to the Israeli times. I mean, really, so I do not personally have a problem with some requirements for public health, you know, water, cholera, disease, infectious disease. That's been going on for a really, really long time. So I personally will not say that the government cannot make any regulations about infectious disease or mosquitoes in water or something. I won't go that far. So that's where I'm trying to walk. I'm trying to walk, you know, he tried to walk right down the middle. Usually somebody will shoot at you from both sides. So but that's okay. I knew what I was getting into and I started the bill.
Representative Stivar.
Thank you, Mr. Chairman, Madam Chairman. That's on this, but you know, there's other vaccines out there that, you know, they're trying to, I think it's the HPV that they've tried to mandate here not too long ago in the state of Wyoming. And the governor didn't sign it. And I was part of the talking about, you know, I don't think that's a good vaccine. So, you know, is there a place in there where, you know, you can get your polio vaccine and all them other ones, but there should be a stopping point. If the parents don't want the HPV, they shouldn't have to take that or this one. And how does this, and that's my first question. And the second question is Senate Bill 2006 for Florida, the banning the vaccine passports. You know, is that part of this? Was any of that brought into this?
Go ahead, Chairman Wilson.
Thank you.
Thank you, Mr. Chairman. So as far as the vaccination mandates for school children, this paragraph 4 would apply to any future, you know, vaccinations against Ebola or vaccinations against whatever. I mean, I deliberately am, I mean, you know, COVID is an inevitable shadow over this, but I tried to write everything in here so it would apply to all things. Nothing would change the ability of parents to say, you know, I have an objection, say, to Ebola vaccine, and your child doesn't have to have it. But if there's an Ebola outbreak, your kid will be sent home. I mean, that will continue in the future as it is now. I'm not changing the process of what happens to the children. So as far as Florida, I have, let's see here. I have something from Idaho. I have something from, I had a couple, Montana, Idaho. And Ohio is what some things that I looked at. I didn't specifically look at it, Florida. The one thing that I will just say is I tried to address when I came to this. In my review of things, you know, in the news and all that across the nation, personally, I felt like some bills that were brought forward were unbalanced in the sense that I think we still feel in Wyoming that business owners have property rights. And I feel that there were some attempts across the nation that didn't take that into consideration and made it very one-sided, which is a great, you know, immediate answer from, well, you can't make me do what I want to do and I can go in your store no matter what. But I don't think we really want to go there, because I think that if it may make some people very happy to say the store can't keep me out, and by golly, they'll sell me what I want to sell when I go in, and they can't tell me how. But I think if you carry that to the final outcome of that attitude, you really won't like where you end up if you're a business owner, because maybe you do want to say you have to have shoes, you have to, you whatever, you can't come in drunk. I mean, there are a lot of things And I think we need to not be really fast to say, this is the one overarching right and nobody else has any. So that's why I really tried to balance when I looked at executive orders and bills nationally, which I felt didn't have as much consideration of the competing rights as I would like.
Go ahead, Senator Bouchard.
Yeah, thank you, Mr. Chairman. I think I just want to add a little to what is being said here. So let's pretend for a minute free speech is the virus. And the reason I want to say that is because there are case laws that are similar to this in free speech. There's a Pruneyard decision affects a lot of malls, and malls have to have reasonable accommodation to allow someone, for instance, to petition the government and go through the mall and have a petition in their hand. They can say, you can do it on Fridays, or you can do it on Thursday, whatever they come up with, but they can't say you can't do it. And so that's kind of how this is written. It's written to that same effect to allow that there are accommodations. So, I mean, I know this, I'm trying to simplify it, but it really is that simple. And if you look at that case law, it's written similar to how this bill is. So I hope that helps. So.
Further questions, committee? I'm not seeing any hands. With that in mind, what is the feeling of this committee? And I will throw in an editorial here is that, and this is an editorial only, is that my feeling from talking with leadership is that there won't be a special committee. That this will, if we move this bill, if we approve this bill as a committee bill, it will move forward to the regular session in February, which again, of course, it will be heard in either the House or the Senate first in the committee. And of course, that arduous process that we go through. So this is our first shot at it. And I think that's important. I think it's a valuable concept. I think it is something worth putting forward. We have lots of time to amend it, adjust it, change it, whatever we need to do with it. That being said, and this is my chairmanship speaking, this is an editorial. I don't want this committee to put out a piece of crap bill, okay? I want stuff that comes out of this committee to be quality. I just don't want something to throw out there and say, let's see what sticks. Let's see what we can fix. Because I think we need to put something out that's quality to start with, okay? You've all seen it. You've all been in the legislature long enough. You've seen some bills come out of, I'm just gonna say other committees because that's not identifying anybody. But you say, how in the world did this get through committee? What in the world are we doing talking about this bill? I don't want this committee to be one of those. If we're going to put out this bill, I want it to be something of quality when we put it out. Now, all that editorial aside, what is the feeling of the committee? Senator Hutchins.
Mr. Chairman.
Oh,
Mr. Chairman.
Who's talking?
I hate to interrupt.
Mr. Doherty.
I guess before the committee moved on to any sort of decision on whether to move this bill forward or not, I was just curious if you wanted to allow for public comment.
Good move. You're having to remind us of that a lot.
It's
We're
new.
out of practice.
And I noticed we'll do public comment after this one on the previous topic, but yeah, if there's public comment in this, because I bet there is.
We have Mr. Glass joining us now.
Okay. Is he there?
Hello, Mr. Chairman. Can you hear me?
There he is. Go ahead, sir. Introduce yourself and address the committee.
Thank you, Mr. Chairman. My name is Brett Glass, and I am from Laramie. I operate a small Wyoming business, and I am an internet provider, which means that I provide a service which isn't on the list in this bill of essential services, but is essential to many Wyoming residents and has been especially during the COVID-19 pandemic. So we have a particular interest here. And I'm afraid that this bill, by declaring vaccination requirements to be an unfair business, not an unfair business practices, but an illegal employment practice, would endanger our ability to provide that essential service. And I'd really like you to consider that before you even consider forwarding this bill out to the rest of the legislature. I am old enough to remember when I was in elementary school having gladly accepted the sugar cube, the Sabin vaccine for polio, which was tested far less than the COVID vaccines have today. And I was proud of having taken that vaccine and helping to eradicate polio. Of course, there are other vaccines that are also mandatory. Nobody who has not had the MMR vaccine is allowed to attend public school or even UW now. And my belief is that this should be extended to COVID in general, and we definitely should not go the other way and prohibit employers from requiring it. This bill in particular would endanger my employees' lives and the lives of our customers. And the reason why is that when we set up internet service for people, we must enter their private homes. Our employees, almost all of them, have to enter multiple private homes every day. These customers have elderly family members who may not be vaccinated or may be vulnerable despite having been vaccinated. The customers may be carrying the virus themselves and may or may not know that. We don't want our employees to be infected, nor do we want them to carry the virus from home to home, which is possible even if they are vaccinated, but although the risk is greatly reduced. And what our company has done is that right now, we have required every one of our employees to be vaccinated. We offered them paid time off to get the shots. We offered them paid time off to recover from any side effects, although none have had any. And every one of them so far has willingly done this. They don't only think it's fair. They're glad that it's a requirement because they believe it's essential to workplace safety. They don't want to be infected by another employee. Now, this isn't a matter of reasonable accommodation, nor is it a matter of so-called freedom. The term reasonable accommodation is misused in this bill because it applies to accommodations for people with disabilities, not to people who choose to endanger themselves or other people. In our mind, at least my mind personally, no one has the right or the freedom to endanger other people's lives, period. It's not a disability if you refuse a vaccination, nor do we need to honor that. People who've fallen prey to misinformation or have malicious intent. Therefore, there's no need to require an accommodation for them, and I don't believe we should. In fact, I think we should exclude them from activities where they might endanger others until they come to their senses and get their shots, which have proven to be safe and effective far more than that, than the Sabin vaccine that I took when I was a youngster. And they're the only bulwark against the continued pandemic and the development and spread of dangerous new variants. It's already deeply embarrassing to me when I talk to people I know around the country that Wyoming is fourth worst in the nation in COVID-19 immunization as of today, and has a higher rate of new infections right now than it did last summer before vaccines were even available. And we in Laramie are particularly worried that the returning students at the University of Wyoming are not being required to be vaccinated and may cause a huge surge of infections in our city when they return. So all I can ask is that you please don't endanger Wyoming residents and present our state to the world as being backward, ignorant, or anti-science by proceeding with this bill. If we and other businesses can't require immunization, we'll seriously consider outsourcing services to company out of state rather than hiring new employees because we don't want to endanger our existing employees in the workplace. We're already considering doing our shopping out of state until our infection rate in the state has gone down. And we really need to we need to do more to protect public health and safety. We certainly don't want to go the other way on this. And again, this isn't an issue of safety, of freedom. If anything, this is an issue of just making sure that Wyoming is a safe place to be. So, Mr. Chairman, I thank you for your time. Again, I really hope that we don't advance any measure such as this to the floor. And I hope that we can instead do something to encourage people to get vaccinated so that we aren't embarrassingly at the bottom of the list in terms of immunization. Thank you.
Thank you, Mr. Glass. Any questions for Mr. Glass by committee members? Seeing none, thank you very much for your testimony, sir. My compliments on your background. It was very captivating. Further comments? Any comments in the room? Josh, step right up to a mic, sir.
Mr. Chairman, members of the committee, Josh Hannes with the Wyoming Hospital Association. Just a couple comments for the board or for the committee's edification. As most people probably know, and just to point out again that measures to protect patients, workers, visitors in hospitals continue today. So no hospitals, to my knowledge, are requiring proof of vaccinations, though the number of visitors continue to be limited. You often have to be masked. And so those continue, and we would and like to continue those practices for the safety of our facilities. And while not related to a COVID vaccine, a common practice in hospitals and nursing homes across the country is to have either strongly encourage or require their employees to be vaccinated for the flu. Those are provided free of charge. And now there are accommodations made for that. If you have, for example, a food allergy or you have a history of allergic reactions to vaccines, you can be exempted from that, but you would have to wear a mask. So in the hospital I worked in, if you weren't vaccinated for the flu between October and I think it was April, this is pre-COVID, of course, you would have to be masked. And so we would just request that that you all are considering those as this bill moves forward and allowing our facilities to protect their patients and staff in the best ways that they know how. And I would stand for any questions.
Thank you, Josh. Any questions, committee? Seeing none. Thank you very much for that. Any further testimony, either in the room or in virtual land? Nothing virtually. If you're out there and want to raise your hand and Katie will let you in. If you're in the room and want to testify, raise your hand, jump up and down, shout, which I'm seeing none of. Okay, with that in mind, we'll close public testimony. Senator Hutchins.
I'd like to move the bill.
Bill's moved, seconded by Representative Stivar, who actually has Senator McEwen's name in front of him. Okay, okay.
Mr. Chairman?
Somebody go ahead.
Yeah, I'm in favor of the bill. I think it's an excellent bill. I would like to make one amendment to this bill. It's on page 3. It's line 3 and line 4. I'd like to expel or exclude, including through media, visual, audio-visual, or computerized measures. I think that that should be excluded, and that would be better to leave that up to the courts. The courts would have their ability to say what is a reasonable accommodation. And I don't think these listed items should be included in the bill. So for that reason, I would move that we exclude those items on line 3 and line 4 on page 3.
There's a second to that amendment. Representative Stivar seconds it. Discussion committee. Senator Bouchard.
Yeah, Mr. Chairman, I'm trying to understand why we would exclude that, because what it's doing is it's a governmental entity or public employee shall provide a reasonable accommodation, including through audio visual. So that allows that to happen unless I'm not reading that properly. So I'd like discussion on that.
Thank you very much. And that would be my consideration of that is I think it includes it. I don't think it requires it. I think it makes it a possibility. Representative Stivar.
Mr. Chairman, the reason I think it needs to be excluded is right now, the way the public meetings statutes read, there's nothing in there on visual or audio Zoom within the public meetings.
Okay, we'll refer that one to judiciary. Well taken. Somebody's got a light on down there. There's a light on, but there's nobody home. Further discussion committee. Go ahead, Representative Halloran.
Thank you, Mr. Chairman. The reason I would exclude this is because that is kind of the minimal accommodation I think that should be made. And I think that the accommodation should be much greater than that. But I don't really want to put that in this bill, that what the accommodation should be. I think that should be up to the courts. The courts should be able to make the reasonable decision as to what the accommodation should be. And I don't think that that's the appropriate thing for this committee to be doing at this time. Thank you, Mr. Chairman.
Thank you, Representative. Senator Bouchard.
Yeah, on against amending, look, I think that, Mr. Chairman, is that this is very permissive here and it has to do with vaccinations. So if for any reason something happens where a governmental entity is going to have a restriction, they have to provide a reasonable accommodation. If we want to include more accommodation, that would be great as we move this bill forward. At this point, taking it out actually moves us backwards. So I think that it's a good starting place where we're at. And we should really give it a lot of thought here. Giving things to the courts isn't what we should be doing. We should be doing it here. And so this is very important that we stay along with what the idea of the bill is here to have reasonable accommodations. So anyway, I say we leave it as it is. So that's my opinion.
Further discussion, committee. Question on the amendment, which is on line 3, page 3, line 3 and 4, excluding or taking out, including through audio, visual, or computerized means. Those in favor of removing that part of the bill, raise their hands. In favor? 2, all those opposed, raise your hands. That is defeated. Further amendments, Representative Worf.
Mr. Chairman, I would ask that we remove throughout the document anywhere where it says provide sufficient proof to strike sufficient, just have it read provide proof of immunization.
Do we have a second to that amendment?
Second.
Second by Senator Bouchard. Discussion by committee. Question, we've had sufficient discussion. All those in favor of the amendment to exclude sufficient out of sufficient proof to change to plain proof. Is that correct, Representative Worf? Throughout the bill, and we can go through and LSO can help us with that. All those in favor of that amendment, raise your hands, please. All those opposed? None. That amendment passes. Further amendments committee. Representative Conley.
Mr. Chairman, on page 8, line 13, add in after the word workplace or public. And so what that would do, boy, I'll have to read the whole sentence, but it adds in, so let me just read it with the new language. It would say, for an employer to require as a condition of employment that any employee or prospective employee be immunized for any preventable disease, unless the employer can demonstrate that an unimmunized employee would create an undue hardship or pose a direct threat to the health or safety of persons in the workplace, and the new language would be or public, that cannot be eliminated or reduced. Mr. Chairman, the reason for that is thinking about a small store, for example, rather than a large one where you wouldn't have more than one employee, but you would have the public coming in. And so that would be the consideration, would be for the public as well as for other workers.
Okay, we have an amendment proposed, page 8, line 13, to add or public. Is there a second to that amendment?
Second.
Somebody said that, but oh, Representative Clifford. I'm sorry, you're so far over there, Representative Clifford. I couldn't see you. We have a first and a second. Discussion committee. Senator Bouchard.
Yeah, on and against the amendment, that it changes the scope of the bill. This is to try to keep it within the scope of an employer. So when we start moving it out into a term public, that opens it up to a whole court challenge that we probably don't want to work on in this bill. So I would be against this amendment.
Further comments, committee? Representative Conley.
Yeah, thank you, Mr. Chairman. Actually, the bill goes into the reasonable accommodation for the public in many other places. So honestly, it is just including it here as well with that recognition.
Further discussion, committee? Seeing none. Question? Question on the amendment on page 8, line 13, adding or public after workplace. All those in favor of that amendment, please raise your hands. 2, all those opposed, please raise your hands. More than 2. That fails. Any further amendments, committee? Further discussion? Are we ready for the question? Question being called. Let's do a roll call, please.
Senator Bouchard. Senator Furphy. Senator Hutchings.
Aye.
Senator McEwen.
He is excused.
Representative Clifford.
Aye.
Representative Connolly. Representative Flitner.
Aye.
Representative Hallinan. Representative Ottman.
Aye.
Representative Romero Martinez.
Aye.
Representative Stivar.
Aye.
Representative Worf. Chairman Baldwin.
Aye.
Chairman Wilson. That passes.
Thank you very much, committee. We will be seeing that again and working on it further. So read it and memorize it. Okay, committee, we're only an hour and a half behind. We're doing really well. That's pretty good for labor and health.
Mr. Chairman?
Go ahead, Representative Conley.
Being the vice chair on the House side, we're a little confused about what we just did. Did we vote on this bill? And so it is now completely done? You just said we'll be working on it in the future, so we're not exactly sure what we just did.
We approved that bill as a committee bill. Speaking in the future, I'm speaking of in future House committee or Senate committee, we will be seeing the bill again. We won't be seeing that bill again here. It is passed out of this committee as a committee bill. Is that clear as mud?
Got it.
Okay, let's decide what we're going to do because we have to break at 4 o'clock. Is that correct, Co-Chairman Wilson?
Is that, yeah, so.
Here, I'm going to pass the gavel back to you.
Mr. Co-Chair, I feel like we're now, I'm not sure. I'm sorry, how late is your lunch facility open? Okay. If a lot of people flooded over, do you think they would be able to serve people between now and 1:30? Yes. Okay. So I'm not saying where people have to go for lunch, Mr. Chairman, but I think reasonably,
That
we
would be a
if
mandate.
we did that and came back by 1:30, because we have an on-site capability, or even a little bit, 1:45, that I'm not sure that the afternoon needs as much time as we have. And we have continuation of aging tomorrow, so I think that would be okay.
Let's plan that then. Let's adjourn until 1:45. And although it's not a mandate, it's highly recommended that you go to the food facility. And we will adjourn until 2 p.m. We'll be back. Thank you, committee.